Let's join our hands for the prayer. Sahanavatu. Om Sahana Vavatu Sahanau Bhunaktu Sahaviryam Karavavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti Shanti Shanti. Hari Om Tat Sat. Yes. Come little bit.
They will be able to ask questions?
Yes, they will be able to ask. Yeah. So, Namo Nama everyone. Thank you for joining for this session. Today we have a special session on CPR and first aid as a part of the syllabus for batch 40. And since it's an important session and we have a special faculty whom we have invited and he was kind enough to accept at short notice. So I thought let me keep it open for everybody. So मैं short में Dr. Sarosh Engineer, he's our faculty. Dr. Sarosh Engineer is a professor of anatomy, teaching human anatomy for more than 40 years. So I'm glad to tell you that he has taught all our faculty, Dr. Jasmine, Dr. Anjali, Dr. Sunita, और जो भी आपको होम्योपैथिक टीचर्स हैं उनको सबको उन्होंने सिखाया है. सो गुरु के गुरु आ गए यहाँ पे. Okay, so today he is a guest professor here. Now he is associated also with the American Heart Association for last 12 years and conducts the courses like basic life support, heart saver, first aid and advanced cardiac life support. So I think in that connection, we have him today over here for this special session on CPR and first aid. I've requested him to speak in English and Hindi both. दोनों में बात करेंगे तो सबको पहुंच जाएगा. He's actively involved in the training of paramedics of government sponsored 108 ambulances. So he's not only in the academics, he's on the ground and he's teaching the medics also, paramedics in the live first aid and CPR sessions. So I think we have got a best person for this topic. That is why I thought that I should share this knowledge with all the other teachers also. That's how so many teachers are there today. Online, 26 teachers are there, 25 teachers are there. So without taking much time, I will hand over to Dr. Sarosh. Yeah. Your sharing के लिए बता दीजिए मतलब whenever you want. I will just share. He's already done.
Yeah. Help you more. So good morning to everyone. I'll talk little in English and in Hindi anyway, wherever it is. But if you have any questions, you are two choices to do. One is you either ask me that time or you ask whenever we take a break. So after 1.5 hours, we'll take a short break and then we'll continue for 1.5 hours. Okay? I don't know whether I should look at you all or down here. I think I'll look here because others, they will not be able to see.
He's setting it.
No, as long as they can see me, I'm in.
They are able to see, but then thanks.
You all can see the screen. देखेगा तो दिखेगा ना भी देखना तुम लोग को दिखेगा if I look down like this at my computer, are you all able to see me? Can someone answer?
Yes, sir.
Yes, sir.
Okay, thank you.
Yes, sir.
Okay, thank you. What we will do is today's topic, I will break up into 4 parts. First will be who can give first aid, how to give first aid, all that. Second will be some medical emergencies. My PPT is very big. It has to run for 4.5 hours. So something in between I'll skip, right? And then third part is when we meet with an accident, get hurt, what to do. That is called trauma. And last is first aid and CPR. So my plan is after a short break in the middle to start CPR. First do the most important thing, and as time permits, we'll come back and do the other things. Okay? So now we are doing the first part as to how to help, whom to help, who, where, how, all those questions as far as first aid is concerned. So a person who's having a problem is called victim. Or sometimes in the slide, you might see the word patient also. Being doctor, word patient and victim, we find it same. So sometimes I might use that word also, but it means one and the same thing. Okay. Now, first thing is, whenever we want to help somebody, we don't want to die. That is the first thing. Okay. So whenever we are going to help somebody in any place, that place I am using the word scene. You know, scenario, scene for short. That place has to be very safe for us. If it is not safe, don't go to help anyone. And little more I'll talk to you about this. So that is the first line. So once you are safe, then only you have to go. So first it should be safe for yourself. Second, it should be for that person. I mean, if you don't go into a building which is on fire, at least try to bring that person out or wait for somebody to bring that person out. Okay. Now I'll show you one slide further and then we'll come back to the slide. You see here one person is swimming and they're drowning. Somebody is coming to save them. Now suppose you're the mother and it's your own child who is drowning in the sea or in the river. Please don't go to save your own child because you don't know how to rescue. You know only swimming. The moment you reach there, your child is going to hold you and your hands are gone, all of you are gone, right? So if you die with the child, your child doesn't need you above, but the rest of the family needs you here. So be alive for them. Your husband, wife, children, mother, father, all need you here. Anyone who is dead doesn't need any other parents above. So don't die for even your own child. Right? So what I'm saying is think with your brain, not with your heart. Right? Apart from this, there is no better example to give. So that means you should not venture into anything which you don't know or where the scene is not safe. You will become a hero. What happens is we see movies and we think that we can do anything. Mission Impossible, Shah Rukh Khan, Amitabh Bachchan, but they have chances to do retake and they are not in danger. We don't get any chance for retake. Ours is one life, gone. You will become hero. Next day your name will come in paper, but as a dead hero. So don't do it. Okay. Now when we go to somebody, because we don't have uniform, we have to first introduce ourselves and say that I know something in first aid, I'll try and help you. Choices are that person will say, no, I don't want your help because yesterday results came, he has not passed, he wants to commit suicide, no help. Another is people will say, yes, sometimes there is no answer. Like we have told children, don't speak to a stranger. So they will not say yes or no also. Or if that person has, had a nice bottle of medicine, international medicine, sab dukho ki ek hi dawa, then also he will not talk with you. Or that person is doing yoga and he's not listening to you because he's in a trance. So then also he'll not answer. Okay. So it doesn't mean that every time a person does not answer, the person is unconscious. This is what I want you to understand. So that person might not be unconscious. Therefore, we learn how to find out whether person is conscious or unconscious. Next step. Then if the person is unconscious, or wherever we feel that the person is not having proper capacity to think, like I said, he has finished one bottle, or a child. In all these cases, we have got permission to go ahead and help them. And all unconscious person also we have to help. We can't ask for their permission. Okay. So that is the second thing, that we ask for permission and we then help. Even if the person says, I don't want your help, don't go from there. Because after some time their pain will increase and they'll say, now I want your help. Or as we'll see, something called person becoming unconscious, not breathing, then there's no need of asking their help. If they become unconscious, we can automatically help. So never leave and go, in short. Whatever we do, we cannot make this person all right. बराबर है? Doctors नहीं हम लोग. Doctor है तो भी कुछ सामान नहीं है, कुछ नहीं है. So we can't make this person all right. So the only person who can make all right is doctor. Doctor is always available in hospital. Fastest way to go to hospital is ambulance. So before we do anything, call ambulance. Most important. Because ambulance takes time to come. There's a joke that pizza will come before ambulance. So we call ambulance first. Okay, all over India, there's one number 108. It is free government service. No need to pay any money. They'll come, they'll take you and go. Okay. Then if you have first aid kit, like in your office, you might have a first aid kit with bandages, this, that, etc. Tell somebody get that. Of course, this word AED that you're going to see, the last word, you're going to see many times. Don't ask me what it is. I'm not going to explain till we do CPR. So just keep seeing the word AED without understanding anything. So this is what we said, ambulance will take 15-20 minutes. So call that first. Now what to do till the ambulance comes? That is first aid. Whatever you will do to help this person, उसका दर्द दुख कम करने के लिए, बराबर? That is first aid. First aid में no medicines. No medicine. Because the moment you give any medicine, you are playing doctor without certificate. That is, then you can go to jail. So no medicines. Any other help that you give without medicine, that is first aid. Okay. So there'll be many things. We'll see what we can do in first aid. You call for first aid and give first aid. This can help us save a life. Your actions can make a difference between life and death. And this is very important, and that we are going to do in CPR. If you don't do CPR, this person will die. If you do CPR, he'll be alive. So this is not just for saying. It is real. It's a fact. And when we do that, you'll understand. Okay. There are no rules in first aid. No rules. Do what you like. Use your brain. You should always think that दूसरे लोग का कुछ फायदा होना चाहिए. उसका दुख दर्द बढ़ना नहीं चाहिए. That is the only rule. Okay, but some guidelines are there. If a person has met with accident, anything, road accident, fall, गिर गया है, मार लगा है, चोट लगा है, बराबर? So not to move that person from that place. Okay? तो मैंने पहले बोला, see that the scene is safe. अभी बोल रहा हूँ उसको वहां से हिलाना मत. बाइक पे से गिर गया रास्ते के बीच में, हिलाना भी मत और सीन भी सेव करना, दो कॉन्ट्राडिक्टरी चीज है. तो द रूल वो उसको उधर ही रखना. 2-4 लोग रास्ते पे खड़ा करके उन लोग को कहिए हाथ हिलाओ और ट्रैफिक को बाजू कर देना. तो जगह भी सेफ हो गया, उसको वहां से हटाया भी नहीं. ओके. एज अ रूल वो करने का हमने देखा है. खाली जब सीपीआर करने के लिए उसको हटाना पड़ेगा तो अलग बात है, नहीं तो वी डोंट मूव द पर्सन. ओके. Then ensure person's safety, comfort. Do not add to the pain. That means if that person is telling मुझे यहाँ दुखता है, उसका हाथ 3 बार हिला के पूछना मत, ये दुखता है, ये दुखता है, ये दुखता है, दुखता है उसने बोला है, वो उसका हाथ हिला हिला के दबा दबा के मत पूछना, हाँ बढ़ाना मत। और ये भी याद रखना उसका दूसरा हाथ बाकी है, 1-2 बार करोगे तो वो ऐसा कर देगा, विच हैपेंस। तो दर्द करोगे तो वो दर्द के लिए मार देगा। ओके, देन कोई रूल नहीं है कि उसको लिटा के रखो कि बिठा के रखो, वॉट एवर कंफर्टेबल करने थे उसको। वे व्हेन मदद करने के टाइम पे व्हेन वी आर हेल्पिंग, वे चांसेस के उसके पास से वो इन्फेक्शन हमें लग सकता है, बराबर। उसके पसीना के कांटेक्ट में आएंगे तो थूक, वॉमिटिंग, यूरिन के कांटेक्ट में आएंगे तो इन्फेक्शन लग सकता है, लगने दो। किसी को बचा रहे ना, थोड़ा तो कुछ होएगा, 1 हफ्ता 10 दिन में दवा लेके हम ठीक हो सकते हैं, नो प्रॉब्लम। पर अगर उनका खून और अपना खून कांटेक्ट में आया तो कई बीमारियां ऐसी है जो होगी जिसका कोई ट्रीटमेंट नहीं है, लाइक एड्स, हेपेटाइटिस बी, ये सब का ट्रीटमेंट नहीं है। मोर देन ट्रीटमेंट नहीं है, if you tell somebody I've got AIDS, that person will take 2 steps back as if AIDS is going to fly and come. So social problem is more than treatment not being there. Social stigma is more, and therefore be careful before you touch anyone's blood. Okay, so in general you're supposed to wear gloves so that you don't come in contact with anyone's blood, right? And then because COVID was there, I said mask also, that is also decreasing the chance of infection. But if you don't have, it's all right. But again and again I'll tell you about blood and gloves, so you will not forget. Correct? We are taught, खाना खाने के पहले हाथ धोना। 90% ऑफ द टाइम हम लोग खाना खाने के बाद ही धोएंगे, खाना खाने से पहले नहीं धोएंगे, बराबर है। वैसे ये बोल रहा हूँ ये करना, बट 90% ऑफ द टाइम्स नहीं करेंगे। बट ग्लव्स यू डोंट फॉरगेट, otherwise you will get a disease for your lifetime. That is what I'm trying to tell you. Now, so many things I've told, we made it into a simple chart, flow chart, easy for you to understand. Or supposing you want to remember, so you can take a pic of this and keep. So this flow chart is what we spoke for all this time. Okay, so it's like, as you can read, see that the scene is safe, introduce yourself, ask permission if the person is conscious, tell somebody to get first aid box, call 108 ambulance, wear gloves. Now what to do? So now you have to check this person in a proper manner so that you don't miss out anything. Okay, so in a proper manner. Now what is that proper manner? Sahi tarika, we will see. But before that, we'll wear gloves. How you wear gloves, it doesn't matter, because we are not doing operations. So wear gloves anyway you like. After you have worn gloves and helped that person, now the gloves is full of blood. So many times what, don't mind my saying, but women get emotional very soon. They'll say, "Ha, I saved that person's life. ऐसा कर दिया तो फायदा नहीं है, तो देख करने का वो कर दिया." करेक्ट? तो वो ग्लव्स के ऊपर ब्लड है, उसको सही तरीके से निकालने का, वो ब्लड और कहीं टच नहीं होना चाहिए। ठीक है? तो जब भी वीडियो नहीं चलता है तो आई यूज दिस। Now, luckily for us today, this video is working nicely here. So we'll see the video only, so you will get a good idea.
Hey everyone, it's Sarah with registerednursern.com, and in this video, I'm going to show you how to properly remove soiled gloves.
Those who are seeing online, can you hear the video?
Yes, sir.
Yes, sir.
Yes, sir.
Yes.
So our goal is to remove our gloves without getting the stuff that's on our gloves on our skin or on our scrubs. So what we're going to do is we're going to take our thumb and our index finger and we're going to pinch the cuff of one of the gloves. Then we're going to take the glove and peel it off. And we're going to grasp the glove completely in our hand and close our hand tight. Prevent it from hanging down because we don't want to touch it. Then we're going to take our index finger of our ungloved hand and we're going to slide it underneath the cuff of the glove. And we're just going to peel it off. And it puts it in a nice little bunch. And then we're going to throw it away and wash our hands. Thank you so much for watching. And
Okay, so One is when we took out the gloves, it is a clean surface which we are holding. Secondly, if you realized or not, we did magic. Wore 2 gloves but took out only one. हाँ, तो उससे फायदा ये होता है कि एक हाथ से ग्लव कहीं रखने जा सकते हैं. 2 हाथ में ग्लव्स रहेंगे तो फेंकने का डिफिकल्ट होता है. तो ये एक ग्लव को ये नीचे लाल रंग की थैली है, ऐसी थैली में डालने का. दैट इज कॉल्ड बायोडिग्रेडेबल बैग एंड ऑल दैट. अपने घर में नहीं रहता है, कोई भी प्लास्टिक की थैली में डाल देना. फिर वो थैली कहाँ फेंकेंगे? वो थैली कहाँ फेंकेंगे? प्लास्टिक की थैली. प्रॉब्लम होएगा. तो कोई ना कोई वो निकालेगा और हमारे देश में उसको धो के फिर से सुखा के बेचेंगे भी. तो वहां नहीं फेंकने का. नजदीक का जो भी हॉस्पिटल है उसमें जाके दे देना. उन लोग के पास ये थैली रहती है. या फिर जब एम्बुलेंस आएगी पेशेंट को लेके जाएगी तो उसके पेट के ऊपर रख देना. वो ऑटोमेटिकली एम्बुलेंस के साथ हॉस्पिटल पहुंच जाएगा. भूल गए तो आजू बाजू के हॉस्पिटल में दे देना. ओके, अपने कचरे में नहीं डालना. सो हम लोग रुके थे. यू हैव टू चेक द पर्सन इन ऑर्डरली मैनर. वी वोर ग्लव्स and now we'll continue what is this orderly manner, how to check this person. Okay, so first you ask, talk to the person. You're going to introduce yourself. Na? My name is this and this, do you want my help? If that person says yes, then we move to the left side. The yes bola, that means he's conscious. Correct. Ask that person, what is your problem, and what we learned today, we will help you. Now we go to the right side of the slide. Right? There is no answer. So is he unconscious? We are not sure. So how to make out a person is unconscious? So please don't unlearn everything that you learned from the movie. The picture may we learn wrong things and come back. So today you have to unlearn. In first aid, you learn also and unlearn both things. Okay? So don't put water on their face. Water, if you put, unconscious person cannot get up. So you don't believe me. I am a tell lies. So I'm asking you, have you heard that people are lying unconscious in coma in the hospital, sometimes for days, sometimes for months? You heard, na? Yes. So those nurses and doctors are also seen in the movies. पूरा टैंकर ही लाके डाल देंगे ना उसके ऊपर जागने के लिए, नहीं उठता है. That means पानी छिड़कने से, पानी डालने से अनकॉन्शियस पर्सन नहीं उठता है. कौन उठता है वो अलग स्टोरी है, बट बेहोश आदमी कभी भी नहीं उठेगा. तो पानी मत डालना, थप्पड़ मत मारना, नहीं उठने वाला है. गलती से उठ गया तो वो थप्पड़ अपने को मारेगा, तो मारना मत. करेक्ट. सो व्हाट इज द बेस्ट वे टू डू, easiest, simplest, safest, time tried method to check whether this person is conscious or not conscious is this. You hit 2 times on the shoulders. The shoulders you can touch very easily, there's nothing here, right? And 2 times you talk to that person. So I'm doing ulta hand, you have to do same. Oh, are you okay? Are you okay? So you hit the person and you ask 2 times only. If there is no answer, that means this person is unconscious. Okay? And we go back to the chart. So now we know this person is unconscious. How we know? Tap on the shoulder and shout. Now a person is unconscious is worse than a person who's conscious. Na? So ये unconscious के लिए हम लोग थोड़ा बड़ा कर दिया chart, right side का. So is the person unconscious? Yes, we have confirmed there is no response. No response means he didn't even do like this, he didn't do that. Nothing they did means this person is unconscious. Okay? Now what do? We call for 108 ambulance. Because we can't make this person conscious. So now is the time we call 108. Or ambulance, whichever you like. Then we look at this person's chest to see whether it's going up and down or not, to see whether it's breathing. सांस ले रहा है कि नहीं. बराबर. ये सब फिगर्स भूल जाएंगे आप थोड़े दिन में, 5 सेकंड 10 सेकंड भूल जाएंगे. तो थोड़े सेकंड के लिए, चंद सेकंड्स के लिए देख लेना. छाती ऊपर नीचे नहीं जा रही है, सांस नहीं ले रहा है. बराबर. एकदम राइट साइड में सांस ले रहा है, लेफ्ट साइड में. तो दो में से अच्छा कौन सा है? सांस ले रहा है कि नहीं ले रहा है? ले रहा है, अच्छा है. तो राइट साइड वाला एकदम खराब है. ठीक है. सांस ले रहा है तो उसका मतलब वो अभी तक है हमारे पास, जा नहीं रहा है, गया नहीं है, तो उसको कुछ कर सकते हैं। तो वो क्यों बेहोश हुआ वो हमें ढूंढना है। वो बाजू वाला बेहोश भी हो गया, उसकी सांस भी बंद हो गई, उसका मतलब मैं आपको समझाता हूँ। आप जहां भी बैठे हो कोई भी कमरे में, एक कोने में काली भैंस के ऊपर यमराज बैठा है। इससे ज्यादा इजी नहीं है समझने के लिए। तो दोनों चीज हो गया है, वो बेहोश भी हो गया और उसकी सांस भी नहीं चल रही है, तो यमराज तैयार है आने के लिए। तो क्या करने का, यमराज को वहां से उतरने नहीं देने का, यमराज को बोलने का आप भैंस के ऊपर बैठे रहिए, कि मत आना, ये कमरे के अंदर आना ही मत, भैंस के ऊपर बैठना। तो उसके लिए हमें क्या करना है, सीपीआर। उसका मतलब क्या है, कैसे करते हैं, वो सब बिलीव, वो नहीं करते, अभी टच नहीं करेंगे। पर वहां एक ही चीज करने का है, सोचे समझे बिना सीपीआर। बेहोश आदमी सांस नहीं ले रहा है, नेक्स्ट शब्द मुंह में से आएगा सीपीआर, और कोई शब्द आएगा ही नहीं। अरे ऐसा क्यों हुआ, वो मेरे साथ तो बात कर रहा था 10 मिनट पहले, उसने तो खाना, कुछ नहीं, अनकॉन्शियस पेशेंट, नॉट ब्रीदिंग, स्टार्ट सीपीआर, नो अदर थिंग, नथिंग एल्स। ओके, so that is the worst one, इसलिए एकदम right side पे। Let's take the middle one. So person is unconscious but breathing. So why he became unconscious, we want to know. So we'll check, try to find out. Okay. So this is how we check for response. Next is, this is how we check for breathing. So you look at the person's chest, no need of keeping hand like in the slide. You have to just look at the person's person's chest, whether it's going up and down for few seconds. Forget how many. You can't remember. One old method is, this is the old method, it was called look, listen, feel. So with your eyes, you look at the chest, like you can see. With the ears, you listen to that person breathing. And if the breath is coming in and out, you'll feel it on your cheek. So that's why it's called look, listen, and feel. But this is time consuming. They have found that every second that you delay in starting CPR, 7% chances of this person coming out of that condition increases. So we don't even waste time. We now do this new method of directly looking at chest. If you are inexperienced, if you are confused, if you don't know what to do, think he is not breathing and start CPR. क्या होगा, जाते बजे जो उठ के पूछेगा ना, भाई साहब आप मेरी छाती क्यों दबा रहे, उतना ही पूछेगा ना, और कुछ नहीं होगा. You are not going to damage anything. Correct? So when in doubt, start CPR. Okay? So now we are looking how we can find out breathing. And now the person is breathing. Remember, we are doing which part? Unconscious person, breathing. Now we want to find out how, what is the problem. So what we are going to do is, we have made this simple. We are going to look at many B's, B alphabet, right? Bites of insects, because that can be seen. Correct? Bleeding, burns, broken bones. When we go to broken bones, I'll tell you how to find out. But for just now, we are doing all these. And bruises means चोट लगा है. चोट लगता है तो स्किन के नीचे लाल हो जाता है ना, रंग बदली होता है, वो दिखता है हम लोग. So we are looking for all this D alphabets. So it's an easy way to remember. Okay. So now how we are going to do, I'll show you with this video.
First, check the scene to be sure it is safe.
Okay, the scene is safe.
Next, tap the victim's shoulder and shout to check for a response.
Hey, are you okay? Are you okay?
If the victim responds, ask if you can help and ask what the problem is. If the victim does not respond or moans or groans, phone for help.
You call 911 now.
Then open the airway with a head tilt chin lift
That's right.
and check for normal breathing.
This is the old method that is still using.
He's breathing.
Look for bleeding and any type of medical information jewelry.
So he's searching now for all those B's. And after he searched for all those B's, they said something like medical jewelry. So in foreign, if the person's having, say, high blood pressure, diabetes, or gets convulsions, fits, akdi, all those, then they give them a bracelet on which it is written diabetes, correct? Or there's a pendant in the necklace on which it is written. In our country, government does not give us any jewelry. Huh? If you have more, they'll take it away. So don't tell them also. Correct? That is why it is called medical jewelry, not Vaman Haripeta jewelry. Okay. So this is how we look systematically for some problem. If nothing is, no, he will, that's what I'm saying. We won't find anything because it might be a medical condition. He might have got a heart attack. We don't know. So what you do, sit there, wait for the ambulance to come. And most important, keep your eyes on his chest. Because if this person stops breathing, you have to start CPR. Otherwise he'll die. Because one, एक चीज तैयार है ना, अनकॉन्शियस तो है, वो सांस ले रहा है करके हम लोग आराम से बैठे हैं, उसकी सांस बंद हो गई तो सीपीआर स्टार्ट करना पड़ेगा, तो उसके ऊपर पूरा ध्यान रख के बैठने का. वी कांट से चलो चाय नाश्ता करेंगे, चाय नाश्ता बट विद आईज ऑन हिज चेस्ट. Okay. Now, suppose this person is breathing nicely. We didn't find any problem. We don't know what to do. We have to wait for the ambulance. Then we put this person in what is called recovery position, provided he has not met with an accident. Because I said, accident person, we don't move. So I will not repeat every time. It is understood. So we put this person in a position called recovery position. First, why to put and then how to. Now, if that person is vomited or if that saliva is collecting in our mouth, bleeding in the mouth, anything, because the person is unconscious, and we'll see again later on, we have got two tubes from the throat going down. One is behind called food pipe, which unless food is there, it is closed like this. When we are eating food only, it will open. But in the front, we have got a windpipe, which is always open because you have to breathe all the time. So whatever collects in the mouth go into the windpipe. Once it goes into the windpipe, it will block the windpipe. Then this person is stopped breathing also. To prevent anything going into the windpipe, we turn the person and put in a certain position. That position's name is recovery position. So I've said, keep the person in recovery position. How to put the person in recovery position, we are seeing in the next slide. But you don't even need brains for this. You don't have to remember anything. How we lie down in the night, in the sleep on one side, left side or right side, same thing. We are sleeping on a pillow. Now there's no pillow. Correct? Use his arm as pillow. That's all. So that's what I've written. Same as lying in on one side. In place of pillow, use the arm of that person, such that the head is higher and above this part, and mouth is down. So naturally things will fall out by gravity. That is the whole idea. मुंह में से सब चीज बाहर गिरना मांगता है. ये दोनों एक ही लाइन में रहेगा तो it will not fall. This should be high, ऐसा, और ये नीचे, तो automatically गिर जाएगा. Not difficult, unless that person is very heavy. Two people can do this. Not necessarily that one only should do. So we'll see here, he's pulling this hand. Okay, he's making it straight. Then he's folded this hand. Not necessary to do. Turn the person, hold one leg, one hand. Turn the person on the side such that his head is on his own hand. Okay, very simple. You can manage, do it. So that was introduction to first aid. How, when, whom, etc. Now we'll go to few medical emergencies. So there's something called cardiac arrest. No, that's what I said. You can give CPR. So when you look for consciousness, unconsciousness, you decided 100 out of 100, this person is unconscious. Okay? Now you have to know whether he's breathing or not breathing. So that blue line, you couldn't make out whether he's breathing or not. You thought he's not breathing and you started CPR. No problem. Because this person does not need CPR in some time, maybe 1 minute, half minute, 2 minutes, he will get up and he will tell you, bhai sahab mera chhati kyun daba rahe ho? But no damage. You are not going to do any damage. So don't worry. In first aid, expect the worst and do it. You will not
First,
medical emergencies. Some will see where you need all the help, and some will see where you don't need it to do anything. You don't even have to call ambulance. You don't even need doctor. You don't need anybody. So both sides we'll see. एकदम दूर तक और एकदम ये बाजू और वो बाजू, उत्तर and दक्षिण ऐसा. Okay, so cardiac arrest, heart attack are not the same. Very important. Because every day पेपर में हम लोग पढ़ते हैं वो आदमी मर गया कार्डियक अरेस्ट से या हार्ट अटैक, एंड ऊपर के लाइन में कार्डियक अरेस्ट लिखा है, नीचे के लाइन में हार्ट अटैक लिखा है, तो वो जर्नलिस्ट डॉक्टर नहीं है, तो उसको भी नहीं मालूम, नॉट हिज. बट एज अ पार्ट ऑफ बीइंग जर्नलिस्ट ही शुड हैव डन प्रॉपर इन्वेस्टिगेशन अबाउट द वर्ड्स, बट ही डिडंट डू. So it's all right, but now we have to learn, so we have to learn properly. These two words are not same, and not same means absolutely जरा भी कोई उन लोग के साथ संबंध नहीं है. इसके लिए नॉट कैपिटल लेटर्स में है, रेड कलर में है, so that you don't ever forget. Okay. So cardiac arrest again we are going to do later on when we are going to do CPR, because now this cardiac arrest word is a medical word put for this condition on the extreme right. When I said unconscious and person breathing is absent, start CPR. इसका मेडिकल वर्ड है कार्डियक. दो चीज का कॉम्बिनेशन, बेहोशी और सांस नहीं चलने का, ये दो चीजें रहेंगे तो मेडिकल वर्ड इज कार्डियक. कार्डियक अरेस्ट बोला कि कुछ भी बोला फर्क नहीं पड़ेगा, आपको सिर्फ वो दो कंडीशन साथ में है उतना याद रखने का है. तो इसमें होता क्या है, हार्ट के अंदर दो जात के काम रहते हैं. ओके, एक इलेक्ट्रिकल एक मैकेनिकल. जैसे मैंने स्विच इधर से ऑन किया तो इलेक्ट्रिक करंट जाता है फैन को, फिर फैन गोल घूमेगा, जो गोल घूमता है वो मैकेनिकल है, करंट उसको आया वो इलेक्ट्रिकल. उसी तरह अपने हार्ट में भी दो चीज है जो हम लोग सीपीआर के टाइम पे बराबर देखेंगे. तो ये दो में से एक या दोनों बंद हो गए, दो में से एक काम बंद हो गया या दोनों काम बंद हो गए, तो उसको हम लोग कार्डियक अरेस्ट बोलते. In short, heart is not working. In short, person is unconscious and not breathing. And still in short, Yamu is on the black buffalo, Yamu ji बैठे. समझ गए आप? Cardiac arrest, Yamu on black buffalo, no breathing, and person is unconscious. Any word you use, as long as you can identify कि ये condition में CPR करने का है, बहुत हो गया. बीमारी का नाम नहीं भी मालूम तो कोई फर्क नहीं पड़ेगा. Nobody is going to ask you, especially not the victim. He is not going to ask you. मैं cardiac arrest में हूँ, so he is unconscious. And only by this one thing you can make out the difference between heart attack and cardiac arrest. Because in heart attack, आदमी बोलता है ना मुझे छाती में दर्द हो रहा है, तो वो कॉन्शियस है, होश में है, तो he is not in cardiac. And सब लोग जो हॉस्पिटल जाते हैं मर नहीं जाते ना, वापस भी आते हैं. That means he is not in cardiac arrest. So WhatsApp में if you find that they will say if you get heart attack, do CPR, please don't do. WhatsApp is gappa, gupshup, electronic, gossiping, electronic. Okay, don't believe anything in WhatsApp, as well as don't believe anything in Hindi movies. It's all wrong, right? So this cardiac arrest we are keeping aside. We'll see afterwards when we start CPR. Right now, this was only to tell you the two words are different. Now in heart attack, what happens? So instead of reading all these stories now, we'll go to something and I'll tell you. So you see here somewhere beyond this point, you can see the cursor there? No, no. I thought so. somewhere beyond this point in that heart, there is something black color. So that much part of the heart is dead, is not working. And if we try to see why it is there, you can see the top figure. That is an artery. Artery means one which carries blood. That has become narrow because of that some yellow thing, and less blood is going. But blood is going, no problem. Now all of a sudden there, you see in the lower diagram, one red blood clot has come and blocked exactly at that same place. So now blood cannot flow behind. So the part of the heart which does not get the blood will die. When it dies, it starts crying. If it cries, we get pain. This is heart attack reason. Can we see this? No, we can't see this. So this is all time pass. Okay, no, this is to make you understand. And then I will tell you how we can make out it is heart attack and what to do. So this is understanding. One more slide for us to understand better. From top to bottom, as we are going, you can see that the yellow thing is increasing, and therefore the space from where blood has to go is slowly decreasing. One fine day, what happens is this thing breaks. Then you see that yellow thing has no. On the right hand slide, top one, that yellow thing has broken and come out. Okay, because it comes there, now it comes in contact with blood. Blood does not like anybody except blood, so it will form a clot. And therefore the whole thing is blocked. Okay, so there is a road on which two vehicles can go together in Mumbai. So किसके पेट में दुखता है? BMC आके रास्ता खोद दे, बराबर है? तो अभी एक ही गाड़ी जा सकती। सो वो हमने ऊपर से नीचे तक जो डायग्राम्स देखे वो BMC ने रोड खोद दिया है, येलो वाला, तो कमती ब्लड जा रहा है। अभी उधर ही एक खटारा आके अटक गया, तो कोई भी आगे नहीं जा सकता। This is exactly what happens in heart attack, which we cannot see, but this is what I have told you. It happens, you have to believe me. Okay, again you can see on the right hand side that yellow part is there, and then there is a red part there which is blocked the whole thing, so there is no blood going down. Now just for your knowledge, that yellow thing that we are seeing in all the diagrams is cholesterol. That is cholesterol, okay, which is deposited there. So now what is heart attack? Heart attack is not heart failure, that's another medical word. It is not cardiac arrest, but a part of the heart is dead. The reason for it to die is there is no blood supply to it. There is no blood supply to it because there is a clot inside the artery. This will manifest as pain and something else, maybe not, maybe yes. Okay. Now, heart is the pump which sends the blood to the whole body. That means when the heart will contract, blood will go to the whole body, come back. So it completes a circle. Because it completes a circle, we use the word blood circulation. Correct? Okay. So this is what happens is mainly that pump is now being affected and it might not be able to do circulation properly. That's what I'm saying. It may or may not be able to do the circulation properly. We don't know. Okay. Now, how do we make out? So heart attack. How to make out? So every chest pain is heart attack. Yes. See the top line. See the top line. Every pain in the chest is heart attack, and go to the last line. Unless ruled out by ECG. So gas है is your supposition. ECG बोला heart attack नहीं है, तो heart attack नहीं है, तो gas है. Until ECG is done, it is heart attack. Okay? पुलिस ने आके उसको पकड़ा, तो अंदर डाल दिया. बाद में मालूम पड़ेगा कोर्ट में कि ये आदमी निर्दोष है कि नहीं, तभी उसको छोड़ेंगे ना. वैसे हार्ट चेस्ट में पेन हुआ तो इट इज हार्ट अटैक. ECG से नहीं हार्ट अटैक नहीं है, तो हार्ट अटैक. तो तब तक के लिए हम लोग को क्या सोचने का? हार्ट अटैक ही है. करेक्ट. पर कौन से टाइप का पेन रहेगा, किधर पेन रहेगा, सो पेन कहाँ रहेगा, बराबर? इट कैन बी पेन, नॉट नेसेसरी, इवन अनकंफर्टेबल फीलिंग इन द चेस्ट कैन बी हार्ट अटैक. मुझे कुछ कुछ हो रहा है. एंड इन हिंदी देयर इज वन वेरी नाइस वर्ड, घबराहट, बेचैनी. These two words have no English translation. घबराहट का कुछ translation नहीं है. That is also heart attack. Okay, it does not have to be pain. कौन से तरीका का दर्द है? जल रहा है, जैसे एसिडिटी में जलता है ना, तो कोई भी तरीका का पेन हार्ट अटैक है. सब तरीके के, स्क्वीजिंग, बराबर, यहाँ कोई ऐसा निचोड़ रहा है, बर्निंग, ट्विस्टिंग, प्रेशर सेंसेशन. अगेन इट डिपेंड्स अपॉन द पर्सन्स वे ऑफ टॉकिंग. और गांव का खेदूत रहेगा तो बोलेगा मेरे छाती के ऊपर बड़ा पत्थर रखा है. पत्थर नहीं रखा है, वो प्रेशर है. So it will depend upon language also. In short, any type of pain can be a heart attack. You can't tell ये पेन रहेगा तो हार्ट अटैक. सब पेन हार्ट अटैक में है. कहाँ पे है? So where is our heart? Middle बस, but no buts and middle. So pain can be classically in the middle, left side, right side, front, back. Correct? Going into the hand, going into the neck, going till the jaw. It can be any pain and it will be heart attack. So from location, we don't know it as heart attack. From type of pain, we don't know heart attack. Whether the pain such में दर्द है कि सिर्फ uneasiness है, we can't make out heart attack. So best cardiologists in the world also can't say इसको heart attack हो रहा है कि नहीं हो रहा है. Correct? Again, WhatsApp पे आपको बोलेंगे हार्ट अटैक हो रहा है तो ब्लड प्रेशर देखो, पल्स देखो, उससे कुछ नहीं मालूम. नो यूज ऑफ सीइंग एनीथिंग. am I clear? ओके. इसके साथ साथ में हो भी सकता है, नहीं भी हो सकता है. सांस लेने में तकलीफ, एकदम अतिशय, मराठी में अतिशय, हिंदी में एकदम, इंग्लिश में प्रोफ्यूज स्वेटिंग. उसका मतलब एसी रूम में भी पसीना आके कपड़े भीग जाएंगे. पसीना नहीं, इतना पसीना कपड़े भीग जाने चाहिए. ओके, इतना पसीना आ सकता है. उसको चक्कर आ सकता है, गिडीनेस, फेंटनेस, नौशिया, उल्टी होगा, ऐसा लगेगा, उल्टी हो भी जा सकती है, कुछ भी हो सकता है. इसमें से कुछ भी नहीं भी हो सकता. मेरा कहने का मतलब एक आदमी आके बोलेगा मेरे दिल में छाती में कुछ तो भी लग रहा है, बराबर नहीं लगता है, इट कैन बी हार्ट अटैक. Okay. Now we are coming to what we have to do. So we can identify heart attack. छाती में कोई भी जात की तकलीफ है, उसके साथ साथ कुछ है नहीं है, फर्क नहीं पड़ेगा, इट इज हार्ट अटैक. तो हमें क्या करने का? सबसे पहले वी कॉल एम्बुलेंस. डॉक्टर है पुट इन ब्रैकेट, डॉक्टर आके कुछ कर नहीं सकेगा, बट चाहिए तो बुलाना टू कंफर्म यस इट लुक्स लाइक अ हार्ट अटैक. ओके. अगर उसके पास ईसीजी मशीन है भी पोर्टेबल, वो लेके भी आएगा, ईसीजी लेके देखेगा हार्ट अटैक है, फिर क्या करेंगे? लेके तो हॉस्पिटल जाना है ना. हॉस्पिटल लेके जाने तो एम्बुलेंस चाहिए ना, तो पहले ही एम्बुलेंस बुला. ओके. टाइम इज वेरी इंपॉर्टेंट. विल डू दिस अगेन इन द एंड. नाउ व्हाट हैपेंस इज, आई टोल्ड यू, वो पंप है ना, और वो पंप डैमेज हुआ है. अब ये आदमी बोलेगा मैं वॉशरूम में जाके आता हूँ, मेरे सब चीज बराबर बंद कर देता हूँ, तो हॉस्पिटल जाने का है ना, तो फिर टाइम लगेगा. तो उसको बोलने का नहीं, यहाँ से हिलने का नहीं, बिकॉज अगर वो मूवमेंट करेगा, एनी फिजिकल मूवमेंट, तो दैट लेग्स, हैंड्स रिक्वायर मोर ब्लड सप्लाई, so that heart will have to pump more. It is already damaged. You will increase the damage. So total physical rest. फिर उस बोलेंगे किधर लेके जा रहा है, बोलता है हॉस्पिटल. क्यों? तो बोलता है हार्ट अटैक आएगा. तो सोचेगा मेरी बेटी का अभी तक शादी नहीं हुआ, बेटे के लिए मैंने इंश्योरेंस नहीं लिया है, उसका कॉलेज का किया नहीं है, तो ब्रेन विल रिक्वायर मोर ब्लड. अगेन वो डैमेज्ड हार्ट हैज टू पंप मोर ब्लड. So keep that person calm. So in short, physical and mental rest. उसको बोलने का रोज तो आप टैक्सी से आते हो, ऑटो से आते हो, आज अपन सफेद गाड़ी से जाएंगे, वो भी लाल बत्ती वाला, मजा आएगा. ट्रैफिक सिग्नल नहीं, ट्रैफिक नहीं, कुछ नहीं, अरे उससे जाएंगे। आई एम श्योर डॉक्टर बोलेगा आपको कुछ एसिडिटी प्रॉब्लम है, वापस गोली लेके आ जाएंगे ना, डरने का क्या है, थोड़ी देर जाके आते ना, मजा आएगा, मैं भी आता हूँ आपके साथ। ओके, सो कीप दैट पर्सन काम। If oxygen is available somewhere, bring oxygen to that person. Don't take that person to oxygen because उसको हिलाने का नहीं। Sometimes what happens, we feel के मैं लेके जाओ ना हॉस्पिटल तो जल्दी पहुंचेंगे, तो हॉस्पिटल वहाँ ही है, एम्बुलेंस आने को 20 मिनट लगेगा, चलो मैं ही लेके जाता हूँ, आप चल के मेरे कार तक आओ, फिर कार में लेके जाओ। नो, if you want, make him sit on a chair, carry the chair to the car, put him in the car, let the car go there, और हॉस्पिटल में से व्हील चेयर ये वो मंगा के लेके जा। करेक्ट, नो फिजिकल। इफ इज ऑन 4th floor एंड लिफ्ट इज नॉट वर्किंग, उसको उठा के लेके आ। अभी उठा के लेके आना अच्छा है, ये तो 2-3 घंटे के बाद भी उठाना ही पड़ेगा, ठीक है। So that was what to do, what we have to do. अभी भाई टाइम इज इम्पोर्टेंट। वो बोलेगा एक काम करते हैं ना, सुबह मैंने आज 2 वड़ा खाया था और वो लाल चटनी मजा आ रहा था, मैंने बहुत खा लिया तो गैस हुआ है, एसिडिटी है, नहीं आने का है, 2 घंटा ठहरते हैं ना, कुछ गोली खाता हूँ, देखता हूँ नहीं ठीक होगा तो जाएंगे। नो, जाने का अभी, बिकॉज वन ऑफ द बेस्ट मेडिसिन विच लैक विल बी गिवन इन फर्स्ट 1 hour। उसके बाद आप करोड़ रुपया देंगे तो भी वो दवा डॉक्टर दे ही नहीं सकता, कि तो वो काम करेगा ही नहीं, इसलिए जल्दी पहुंचेंगे उतना अच्छा है। अच्छा, यू मस्ट हैव हर्ड समटाइम्स इन द न्यूज़पेपर गोल्डन आवर, ऐसा वर्ड लिखा है, that person has to be shifted in golden hour and all, so you have to go to the hospital as soon as possible। और अपने कंट्री में हॉस्पिटल जाने के बाद क्या होता है मालूम है ना, फॉर्म भरो, ये करो, उधर जाओ इधर जाओ, ये डॉक्टर देखेगा फिर वो देखेगा, ऐसे सब चलता है। Yeah, so that's why I said nothing. Pain high means this heart attack unless ECG tells. Even बेचैनी is enough. ECG हाँ ना बोलेगा तब तक वो हार्ट अटैक ही है। छाती में कुछ भी हुआ, unless ECG says no, it is heart attack. Diabetics are not prone, but they cannot express pain. उन लोगों को पेन महसूस नहीं होता है। ओके, दैट इज व्हाई यू डोंट डिले। इसलिए फर्स्ट कॉल एम्बुलेंस, इंटेंसिटी कम हो जाता है, इंटेंसिटी कम होता है। समझिए कि आपको 100 है पेन का लेवल, डायबिटिक को 20-30 देगा, तो नर्व्स डैमेज हो जाते हैं इसके लिए। ओके, अभी विल डू अ डिफरेंट कंडीशन जिसमें डॉक्टर भी नहीं मांगता है, कोई नहीं मांगता, चक्कर आने का। इंग्लिश में एक्चुअली देयर आर 2 डिफरेंट वर्ड्स। डिजीनेस, गिडीनेस मीन्स गोल घूमने का चालू होता है, और जब आदमी गिर जाता है तो उसको फेंटिंग बोलते हैं। हम लोग सब वर्ड्स ऑलमोस्ट सेम यूज करते हैं। पर क्या होता है, आदमी गिरने के पहले उसको चक्कर जैसा आता है, गोल घूम, तो जब आदमी गोल घूमने लगता है, चक्कर आने लगता है, तो उसको लिटा देना, उसको लिटा देना, नहीं तो वो गिरेगा ना, गिरेगा तो एक्स्ट्रा चोट लगेगा, बराबर। वो क्यों गिरेगा वो इम्पोर्टेंट, ठीक है। तो अभी चक्कर आने के बहुत सारे कारण। फोन पे किसी ने बोला सेठ आपका गोदाम जल गया, 2 करोड़ रुपए का नुकसान हुआ, तो उसको भी चक्कर आएगा। 26 जनवरी 15 तक अगस्त को बच्चे लोग से ग्राउंड में खड़े हैं, उन लोग को भी चक्कर आता है 2-3 घंटे के बाद। बाकी लोग को कोई भी कारण से भी चक्कर आता है। तो ये चक्कर आने का फेंटिंग इज, दिस इज द ब्रेन। ब्रेन ऊपर है, जो भी ऊपर है वो बॉस होता है, तो ब्रेन इज बॉस। ये याद रखना इंपॉर्टेंट है, ब्रेन इज द बॉस। एक येलो कलर का जूस उसके पास नहीं जा रहा है, बराबर। हमें चाय चाहिए, तो 11 बजे चालू किया तो 12:30 बजे ब्रेक लेंगे तब भी चाय मिलेगा। अभी बीच में चाय मांगता है तो नहीं मिलेगा। बॉस को चाय मांगता है तो क्या करेगा, बिल बजाएगा, कोई आएगा चाय लेके आ, हो गया ना, उसको मिलता है। ये बॉस को अभी नहीं मिल रहा, इसको अभी का भी चाहिए, तो ये क्या करेगा, हमको बैलेंस हमारा खवा देगा, लूज द बैलेंस, so we go round and round, then eventually we fall. See, got it? मिल गया, खुश, बंद हो गया चक्कर. It is so simple. This is the whole reason behind it, that the brain cannot tolerate without being blood supply for even few seconds. तो मेरे को गोल घुमाएगा, गिरा डालेगा, ऑटोमेटिकली उसको ब्लड मिल जाएगा, वो बोलेगा अभी चक्कर बंद कर दो, क्यों मन, ये सब मैंने इंग्लिश में लिखा है. ओके, व्हाट डू वी डू, make the person lie down. So why I'm telling is we are going to face this every day. Crowded train, सुबह आ रहे, सब ट्रेन फुल है, किसी को चक्कर आ गया, उसको पानी मत पिलाना, उसको हवा मत मारना, किसी को बोलना मत है उठ के जगह दे, उसको चक्कर आ रहा है, फायदा नहीं, उसको लिटा देना, गंदा जगह में लिटाने का, अच्छी जगह में बिठाने का नहीं, तो ये ऊपर है तो इसको ब्लड नहीं मिलता. ओके, अभी ये चक्कर के बाद कुछ कारण था चक्कर का जो हमें नहीं मालूम है, इसके लिए ऐसा लगता है कि आदमी सो गया है. ठीक है, सोने दो, चेक करो बेहोश है क्या होश में है, बेहोश है तो सांस चल रहा है कि नहीं, दोनों नहीं है तो सीपीआर भी चालू कर. बराबर, तो दिस इज अ टेम्पररी कंडीशन. इसलिए हिंदी पिक्चर में अगर पानी भी मारा तो आदमी आंख खोलेगा ना, आंख तो खुला ही रहेगा उसको. समझ गए क्यों हिंदी पिक्चर में उठता है, तो ये टेम्पररी चीज है, लेटा हुआ आदमी हमेशा पेंटिंग में से बाहर निकलने ही वाला है. ओके, नहीं उठेगा तो उसका चेक कर, उठेगा तो डोंट इवन बॉदर. In this video you will see that lady is feeling, she's going round, nobody helps her to supports her and puts her down, so she falls down. In this case there is chance of getting hurt.
So here, how to know the patient is fainting or not and how to help them. The patient may feel very dizzy, lightheaded because of something out of mind. Hard to say, yeah. He or she will fall down. Try to keep the victim remain laying down very comfortable and try to lift their feet up above the body a little and try to.
That was also wrong. You never make the person get up immediately. Let them lie down for some time. Okay. Now see the difference between this. This only about half is going. But if I lift this, full is going. So all that you can do is similar thing. Raise their legs, so more blood will go to the brain. If you're in a crowded place, where ऐसा कुछ रख नहीं सकता है, बैठ करना और उसके पैर अपने कंधे पे रख देना. हो गया. Simple. Now we are doing what is called fits, convulsions, seizures. The reason for to take this topic is because बहुत सारे इसके ऊपर myths है. What is to be done? So something like that occurs. जैसे झाग या फेस आता है मुंह में, जीभ बाहर आती है, eyes roll up, all that you can see in that picture. Okay, so what to do in this? That is what you have to learn. So now the brain controls the body. Now if the brain tells that pick up that glass and drink water, so the glass will go only to the mouth. Have you ever thought why it's not going to the ears? It is so much a part of our system right from the word day one. कभी भी कान में नाक में नहीं जाता ना पानी, मुंह में ही जाता है. पीने के बाद ग्लास उधर ऐसे नहीं लेके बैठे रहते हम लोग, वापस नीचे रख देते. तो ये सब ब्रेन इज टेलिंग द बॉडी टू डू. इस बॉस ना इज टेलिंग करो, ये करो, वो करो. अभी बिना कोई कारण इफ द ब्रेन टेल्स हाथ मोड़ो, सीधा करो, हाथ मोड़ो सीधा करो, पैर मोड़ो सीधा करो, मुंह खोलो, जीभ निकालो, मुंह बंद करो, बिना कोई कारण, and it keeps on telling, then whatever action is happening is called fidget. तो ब्रेन वेरी सून रियलाइजेस कि जो मैं करा रहा हूं उसका कोई मतलब नहीं है, तो उसको होता है बंद कर दो. So all fits stop around 3 minutes, maximum 5 minutes, unless there is a reason. So it is always self-limiting. करेक्ट. देखा कि इसको फिट्स आ रहा है, फिट्स आ रहा है, 2-3 लोग चिल्लाया, कोई किचन में भागा, प्याज काटा, लेके आया, सूंघाया, 3 मिनट हो गया ना, तो प्याज का नाम अच्छा हो जाता. किसी ने चप्पल लेके आके सूंघाया, सब डालो ना. बंद किसने किया? बाकी सब लोग को क्रेडिट. एवरीबडी गेट्स क्रेडिट फॉर ब्रेन्स वर्क and miss work. So it is a temporary phenomena which stops on its own. Okay. Let's see what all we have written here. So there is medical condition called also epilepsy, which is also same, but then you don't bother, you don't know whether it's epilepsy है कि इसको fits आ रहा है. जिसको epilepsy है वो रोज दवा खाता है या वो डॉक्टर के पास गया, उसको मालूम है. So this can be because of other reasons which I'm telling, like heat stroke. Heat stroke means sunstroke. Or small children who get high fever. Okay? ब्रेन में मार लगेगा, चोट लगेगा, एक्सीडेंट होएगा, तो ऐसे बहुत सारे कारण है. या फिर जब भी ब्रेन अपने आप काम एक्स्ट्रा करने को चालू करता है. इसमें क्या होता है, मसल जो है वो कॉन्ट्रैक्ट होता है, रिलैक्स होता है, हाथ पैर के, मुंह के भी मसल्स है, तो मुंह खुलता है, बंद होता है, खुलता है, बंद होता है, ऐसे सब होता है. उसके साथ साथ वो मुंह में आता है, आंख ऊपर से आता है, वो सब करता है. हमें क्या करने का?
I got loads of work for college and that. Nah, he wouldn't know any better. Besides, it has nothing to do with him.
Sid, it's all right, mate. It's okay. I know what to do. Right, just pop that under your head. There you go. Okay. I'm going to stay with you until it's over, okay?
कुछ टाइम लगा, that got over. Now he's putting him in recovery position, which we saw initially. Now you see it exactly being done.
Just going to roll you onto your side, mate, so you can sleep it off.
The back of his head is high,
Tilt your
mouth
head
is
back,
low.
mate. There you go. Just keep it there for me.
He's checking whether he's breathing. Old method. He's happy he's breathing, so no problem.
You're all right, Zed. It's okay, mate.
So now,
I'm with you.
let's see. What do we do? Nothing. I'm not using the word nothing. Especially I've broken the word into 2 parts. You do nothing. कुछ नहीं करने का. Okay? While this is going on, if the person is going to get hurt, prevent him getting hurt. So move the furniture away or whatever is there. If the ground is hard, concrete, then put something under his head, not a pillow. You saw he put his jacket, small towel, t-shirt, anything, but not a pillow, because pillow will make the head like this. Never stop. Don't hold the hand, don't hold the leg, right? Don't do anything. Then people say put something in the mouth. Okay? So 100 out of 100 times don't put your finger, because when he closes the mouth, this much of the finger will go inside. You will be without the tip of your finger. That's not a problem. That is not a problem. But this tip of the finger, if it goes in the windpipe, now he'll die. He was never going to die, but you are killing him. So don't put finger. So everybody will say, हाँ, will not put finger. Spoon डालेंगे. वो भी stainless steel का. हाँ? हाँ. So let's start. डालने का क्यों? So first time जब ये मुंह बंद हुआ ना, टंग बाहर था, तो टंग कट हो गया. तो कोई केसेस में दे हैव हर्ड टंग कट होता है. बराबर? अगर टंग अंदर था और 10 बार मुंह खोला बंद किया तो टंग कट नहीं होने वाला है. हम लोग स्नेक नहीं है घड़ी घड़ी टंग बाहर निकालने के लिए. अगर हमारा टंग अंदर है तो अंदर ही रहेगा, और बीच में था तो पहला ही बार कट हो गया. अभी कुछ भी डाल के फायदा क्या है? कुछ नहीं. अच्छा स्टेनलेस स्टील का स्पून डाला, ऊपर के दो नीचे के दो 4 दांत गए. वो दांत अगर विंड पाइप में गया तो वापस मर गया. नहीं गए तो 10-15 हजार का डेंटिस्ट का बिल अपने को भरना पड़ेगा. दांत तो हमने तोड़ा ना, बिल हमें ही भरना. तो डू नथिंग, एब्सोल्युटली नथिंग. ओके. पहले बार में अगर टंग कट हो भी गया तो नो प्रॉब्लम, एनी डॉक्टर कैन स्टिच इट. जैसे आप लोग को कहीं चोट लगेगा डॉक्टर कैसे स्टिच करते हैं, वैसे ही स्टिच करने का है. अगर अच्छा कराना है तो एक हॉस्पिटल में जाके कोई सर्जन के पास करा सकते हैं, ज्यादा पैसा खर्चा. नहीं तो अपने फैमिली डॉक्टर भी स्टिच करके दे सकते. ओके, ठीक है. वो डेंटिस्ट के पैसे से कमती है. वो they open and close continuously. See, this we are folding and opening. Similarly, jaw is opening, closing. If tongue was in the way, it got cut. It was not in the way, never get cut. That is different disease condition. That's called lockjaw. That happens in tetanus. नहीं होएगा लॉक. ये नहीं हो रहा है ना लॉक, हाथ पैर लॉक नहीं हो रहे ना, तो ये भी नहीं होएगा. ये भी जॉइंट है ना, मसल्स ये है. सेम एक्शन. Understood? Just like that. Same thing is happening everywhere. Because brain is controlling everything. By the way, हम लोग कैसे मुंह बंद करते हैं? ऐसे ना? नहीं, ये कभी भी हिलता नहीं है ऊपर वाला, खाली नीचे वाला हिलता है. हाँ, ऊपर वाले ने हमें प्यार से बनाया, नहीं तो टीवी चाहता था ना खाना खाने के टाइम. ये भी ऐसे नीचे आएगा तो टीवी नहीं दिखेगा ना आंख के साथ. ये फिक्स रहता है, खाली यही ऊपर नीचे होता है. ओके. I'll finish this one thing. So after this, next one I'm not doing. I don't think this. Choking will do after eating. This I want to do. According to me, this is a very important thing. Stroke. Correct? I say that in your whole lifetime, if you can prevent one stroke, you don't have to go and take bath in Ganga. गंगा नदी में स्नान करने की जरूरत नहीं है, सब पुण्य धुल जाएंगे. यू हैव इंटरनेशनल योगा इन ऋषिकेश ना, ऋषिकेश वगैरह में होता है ना इंटरनेशनल योगा का सेलिब्रेशन. सबसे ज्यादा सब गंगा क्लीनेस्ट देयर. हरिद्वार में बहुत गंदा है, तो यू डोंट हैव टू गो देयर टू टेक बाथ. एक स्ट्रोक बचा लो. स्ट्रोक क्या है, एक्सप्लेन टू यू इन 1 minute. बट आफ्टर स्ट्रोक व्हाट हैपेंस इज पैरालिसिस. Effect of stroke is paralysis. Any child will tell you, हाँ इसको लकवा हो गया है. You have to find out when the stroke is occurring and prevent paralysis. That is what is your work. Because a person who becomes paralyzed, suppose it's the man of the house, his wife is going to look after him full time because he can't walk, he can't take bath, he can't go to toilet, he can't eat himself. Nothing he can do, so the wife has to feed him, do everything for him. Full 24 hours, they have to do. If there are 2 children, we are not even talking of parents, 1 or 2 children, they are going to school, coming back. Who's going to earn money for this family? Husband not working, wife not working. Few days, people will give. After that, nobody gives. So if you save one stroke, you are saving 4 lives. Correct? Forget this man cannot work. We are not even thinking about that. We'll think about his emotional state. Full day is thinking, what am I sitting here, lying here? My wife has to look after everything, do everything for me. If he wants to button a shirt, you know, it comes so much automatically to us. Try buttoning the shirt with one hand. Nahi hota hai. Very difficult. So even to put button to the shirt, that person needs somebody's help. And 24 hours, he is only thinking, kya hua hai mujhe, kyun hua? Right? So there's a lot of mental, financial, this, that, everything is there. So prevent stroke, don't let stroke occur. Very important. So, 2 words, like heart attack, if it is happening in the brain, it is called stroke. So in heart attack, we saw there's a clot in the artery, खून के नस के अंदर गड्ढा हो गया है, उसके कारण से एक हिस्सा काम नहीं कर रहा है, वो हिस्सा अपने बॉडी को कंट्रोल करता है, वो इसके लिए बॉडी आधा बॉडी काम नहीं कर रहा है. तो जैसे मेडिसिन हम लोग हार्ट अटैक में देते थे वो यहाँ भी दे देते हैं, सिंपल. बट यहाँ और एक नई मुसीबत चालू हुई. जैसे यू कैन सी इन द डायग्राम, पहला वाला जो है इट इज बिकॉज ऑफ क्लॉट, बाकी का ब्रेन को ब्लड नहीं मिल रहा है. बाजू वाले में देखिए आप खून के ड्रॉप्स सब कम है. Now on the right hand side you see it is bleeding. ब्लीडिंग हो रहा है, ब्लड बाहर निकल. अभी वहां द ट्रीटमेंट इज क्लॉट बनाने का, बिकॉज इट इज ब्लीडिंग. लेफ्ट साइड वाले में क्लॉट निकालने का. सो डॉक्टर के हाथ भी बंधे हैं. क्लॉट निकालने की दवा दोगे, क्लॉट बनाने की दवा दो. विच टू गिव मेडिसिन, मेक द क्लॉट और डिसॉल्व द क्लॉट. दैट इज द बिगेस्ट प्रॉब्लम इवन फॉर द डॉक्टर. फर्स्ट लेट्स सी आवर पार्ट, देन विल सी डॉक्टर्स पार्ट. Both presentation will look same. We cannot go inside his brain and see. For that matter, doctor also can't see. On the left side, you can see bleeding is occurring. Right side, you can see clot is there. Now, how to make out? So, suddenly, the word is suddenly, अचानक. अगर आदमी खड़ा नहीं रह सकता है, गिर जाता है, 1 या 2 आंख से दिखता नहीं है, बात नहीं कर सकता है, कुछ भी चीज अचानक हुआ, 1 सेकंड पहले नहीं था, अभी हुआ, तो इट इज इंडिकेटिंग स्ट्रोक. So somebody tells, so ऐसा हुआ है, now we want to confirm. Yeah, we want to know. So there are only 3 things, simplest things. Even if you get one of these 3 positive, it is 70% chances of stroke. 70, okay? And even if you feel 1% chance it is stroke, go ahead and do something. Tell the person to smile. Both these are in same line. If they are not in the same line, like you see in this diagram, that means stroke, 70%. It's definitely stroke. It is said, tell the person to keep both the hands like this. ऐसा पाम ऐसा ऊपर, उंगली खुला हुआ, आंख बंद करके. आई एम टेलिंग यू, कुछ भी याद रखना, हाथ ऊपर रखने बोलना. थोड़े समय के बाद, few hours, this side is going to get paralyzed. So today there is only, अभी just weakness हो रहा है, तो ये ऐसे नीचे जाएगा कमजोरी से. This gravity is there, ना, gravity is pulling it down. Okay, that is telling you 70% chances stroke. Last is you tell the person to tell something. Very simple. बाहर सुबह है, अभी सुबह है बोलो. 2 बार बोला, 3 बार बोला, बात ही नहीं करे. No speech. Or that person will say like that, बाहर सुबह है, like that. That is called slurred speech. Forget the word. बराबर बात नहीं किया, बात ही नहीं किया, बराबर बात नहीं किया, ये तो गलत बात किया. 16 सुबह है बोलो, तो बोलेगा कुर्सी पीली है. तो यूल से हाँ कुर्सी पीली है, दैट इज ऑल राइट, बट से सुबह, वो बोल रहे हैं अभी सुबह है, मुंह में से निकल रहा है कुर्सी पीली है. सो नो स्पीच, improper speech, wrong speech, anything to do with speech which is not correct. Again, 70% chances. So all three don't have to be there. Anyone is enough. Now you have to note down the time. Very important. Time is very, very important. So when we mix up these four things, face, arms, speech, and time, it comes to FAST. Fast. So in stroke, always act fast. Okay. So this is called face drooping. Technical words. We don't have to remember. Something wrong with face, something wrong with arms, speech not proper. Note down the time. And I have to tell you that in great detail. Note down the time. Okay. You have to act fast. So remember fast what you have to do. So that will be the last slide. We'll see the video and the last slide and we'll stop. Look at the lady's face. This all is gone.
When a stroke strikes, it spreads like a fire in the brain. The longer it goes undetected.
Sorry, I should have told you this. They are saying that stroke is like a fire in the brain. Like, not real fire. Asli aag nahi laga hai, uske jaisa hai. So sometimes people are not able to hear the video. So it is like that. And like fire, it will keep spreading. And that's why they say it is time to call the fire brigade, so call the ambulance. Okay? But there is no real fire inside. No, because you are hearing. Sometimes people don't.
The more damage is done. To spot the signs of a stroke, you have to think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. Just like a fire, it's time to call 999 if you see any single one of these signs. The faster you act, the more of the person you see.
So this was a British video. There the emergency number is 999. Pardon? Actors? Yeah. This acting only. Okay. So again, like heart attack, most of the things like heart attack, because this is a heart attack of the brain. But don't use heart attack of the brain. Phone, doctors in brackets, useless. All for ambulance. Okay. Again, time is most important. Like there, same thing here. There we had 1 hour time. Now let's see how many hours time we have. So we have to note down the time when this started. This could have started at 7 o'clock in the morning when they got up. It happened to the man. So we are in India. His wife will rub, he will rub, he'll put some hot, then some cold thing. ठीक हुआ नहीं हुआ अच्छा चाय पी लेते हैं चाय पिया तो चाय यहाँ से गिर गया फिर अभी ज्यादा हुआ ना चाय गिर गया में कुछ तो भी हुआ फिर क्या करेंगे सूंठ लगाएंगे अदरक लगाएंगे कुछ तो भी करते हैं in our country we don't go to the doctor first we do all home remedies then neighbors remedies if you are young Google's remedies then third day you go to doctor and then what you tell doctor give me strong medicine I want to go to work tomorrow 2 दिन घर में तुम बैठे रहे अभी स्ट्रॉन्ग दवा देगा फिर डॉक्टर का नाम खराब डॉक्टर स्ट्रॉन्ग दवा दे करेक्ट so like that same thing will happen here also they will waste about 1 hour and suppose they know that you know something or you're young you'll understand something they call you so this started at 7 o'clock you went to their home at 8 o'clock you thought it is stroke 5% chance why not try nothing wrong na so you are going to follow what we are going to learn. You have to tell that person that you tell the doctor when you reach there, this started at 7 o'clock. Once you reach the hospital ward, the nurse will say, सब relatives बाहर खड़े रहो, कोई भी अंदर मत आओ. अरे बोलेगा कैसे 7 बजे चालू हुआ? Chance ही नहीं है. So if you feel this is going to happen, write here 7.00, 7 a.m. Write anything. Because we never cover the patient's face till he dies. Doctor knows why you wrote 7 o'clock. He understands. So you write here and send. 100% sure. Okay. If this person had gone to sleep and got up, that means when he went to sleep, that is the last known time, huh? Not when he got up with this. So whatever the last known normal time, that is to be written. Write it here and send. Now what happens is, does the doctor know isko clot banane ka dawa दें कि clot पिघलाने का दवा दें? नहीं. So minimum we have to do a CT scan. Minimum. X-ray is useless. MRI is good but more costly and not available everywhere. CT scan is easily available. So this person, you have to tell the ambulance person पहले CT scan के लिए लेके जाओ. CT scan करा के बाद में hospital में लेके जाना. या take to such a hospital which has got CT scan. Otherwise they'll take to the hospital, ambulance will go away, then they'll say CT scan बिना डॉक्टर कुछ नहीं कर सकते, दूसरा एम्बुलेंस बुलाओ, वापस जाओ, वापस आओ. So it is your duty to tell them go for CT scan. Okay, so that's why last written I've written treatment can only be given after knowing whether there's a clot or there is bleeding, and that can be only made out by CT scan. X-ray is useless. Don't send for X-ray. This is just for your information, showing you that on the left side it is because of clot, because there is no black area of bleeding there. Their blood clot has collected. This is just to make you understand, nothing that you have to know. So that is how even the doctor comes to know, and then he decides to use the medicine. In 3 hours, the medicine has to go inside the veins. Before that, you have to do many things and find out, right? And then only the clot can be dissolved. Because 85% of the stroke is because of clot. 13 is because of hemorrhage, 2% is another reasons. Like tumor is there in the brain, that's why. Again, on CT scan, we can make out tumor, so they know what to do to it. Okay? Understood? So here, though there is 3-hour period time, that lot of time is going to go in finding out CT scan. And therefore, we have to note the time and send. Otherwise, because we are in India, even if you reach in 3 hours, the doctor will take for granted you are not come in 3 hours. They will not give the best medicine. They will give the second best medicine. Okay. Shall you take break? And yeah. One second. I'm just telling that we are taking a break for 15 minutes. If you 5 to 10 minutes just for relax. 5 minutes. If you have any questions, then ask during this time. Those who are online. Go ahead.
Sir, I have a question. I can ask now?
Yeah, ask.
Thank you. Sir, कभी ब्लड शुगर भी बहुत कम हो जाता है, तो आपने जैसे सिम्टम्स बताए कि स्पीच एकदम अलग हो जाना, मतलब वो बराबर से नहीं बोलना, वो सब तभी भी होता है ना?
मैं बोलो अभी. I'll answer your question. Shall I answer your question?
Yes, sir. Yes.
Okay. When blood sugar becomes less, बराबर पहले तो आदमी एकदम थक जाता है जैसा होता है, उसके पास ताकत नहीं है वैसे. उसके बाद ऐसा होता है कि उसके हाथ पैर पूरे ढीले हो गए वैसा होएगा और वो गिर भी जा सकता है. उसके बाद और उसका ब्लड शुगर कमती होते जाएगा, वो बेहोश भी हो जाएगा. तो ये सब चीजें इसके जैसे दिखेंगे, जैसे पूछ रहे आप उसके जैसे दिख सकता है सब चीज, बराबर. पर उसमें प्री कंडीशन रहेगा कि ये आदमी डायबिटिक है, उसने दवाई ली और खाना नहीं खाया, या उसने इंसुलिन गलती से ज्यादा ले लिया और खाना कमती खाया, या इंसुलिन लिया, गोली लिया, खाना खाया पर खाना पूरा वॉमिट हो गया, तो फिर ब्लड शुगर कमती हो सकता है. तो ब्लड शुगर का अगर हिस्ट्री नहीं है तो फिर स्ट्रोक. ब्लड शुगर का हिस्ट्री है तो फिर स्ट्रोक नहीं है. अभी इतना पूछा करके मैं बोल देता हूं आपको, कोई भी डायबिटीज का पेशेंट रहेगा और उसको कोई भी तकलीफ होने लगेगी, जैसे सब हमने बात किया ना, तो कमजोरी लगेगी, हाथ पैर नहीं चल रहा है, कुछ भी होएगा, उसको पहले मीठा खिला देना या पिला देना. सबसे पहले मीठा पिलाना. मीठा पिलाने का नहीं है तो मीठा खिला देना, बाद में बाकी का बात करना. वो आदमी बोलेगा मैं डायबिटिक हूँ, मेरे को शक्कर दोगे तो वो मेरे लिए जहर है, बोलना नो प्रॉब्लम खा लो. और अगर वो ज्यादा अगर आपके साथ बहस करेगा तो बोलना आप कभी कभी शादी में जाते हो ना, वहां आप 2-4 गुलाब जामुन खा लेते हैं, आइसक्रीम खाते हैं, आप मर नहीं जाते वो रात को, आपका ब्लड शुगर बढ़ गया था तो। अभी हमें मालूम नहीं आपका ब्लड शुगर घटा है कि बढ़ रहा है, तो आप मिठाई खा लो, घट रहा है तो आप बच जाएंगे, बढ़ रहा है तो कुछ नहीं होने वाला है। कल भी आप जिंदा ही रहोगे। ओके
Okay. Okay.
तो
And
जिस भी
sir,
डाउट,
one more. I have one more question related to stroke. Blood pressure is the main cause behind stroke occurs, right? So आप उसके बारे में कुछ बताएंगे? Blood pressure is the main reason stroke
और
आने के लिए blood pressure.
नहीं नहीं नहीं, उल्टा, क्लॉट आने का और ब्लड प्रेशर के साथ कोई संबंध नहीं है कहीं भी बॉडी में, हार्ट में भी नहीं है, ब्रेन में भी नहीं है। बट ब्लड प्रेशर में यू माइट बी नोइंग 2 लिमिट्स रहते हैं ना, जैसे 120 है और 80 है, तो सिस्टोलिक एंड डायस्टोलिक। तो सिस्टोलिक लिमिट, सिस्टोलिक ब्लड प्रेशर कंसिस्टेंटली यानी काफी समय तक 200 के ऊपर रहेगा हमेशा, 200 के ऊपर, तो वो आर्टरी बर्स्ट होने का चांसेस है और ब्लीडिंग होने के चांसेस है। क्लॉट कभी भी ब्लड प्रेशर, क्लॉट एंड ब्लड प्रेशर को कोई संबंध कहीं भी शरीर में नहीं है। ओके
Okay, thank you.
So may I ask the next question?
या गो अहेड।
Yeah, so my daughter, she's 20 years old, and usko when she was 11 or 12 years, since then usko periodically, say after 6 months or so, faint होती है वो। जब वो faint हो जाती है,
नहीं नहीं, आई डिडंट अंडरस्टैंड। छोटी उम्र से,
my
11-12 की उम्र से था और अभी
हाँ,
है
अभी
what?
तक है उसको, अभी तक है उसको ये प्रॉब्लम, वो फेंट होती है। मतलब
हाँ
फेंट यानी शी रिस्पॉन्सेस नॉट एग्जैक्टली फेंट, बट वो चक्कर खा के गिर जाती है, बैलेंस नहीं रहता बॉडी का, और पूरा परस्पायर हो जाती है, इतना पसीना पसीना होके गीली हो जाती है। और
हम्म
उसको है ना एपिलेप्सी के स्पेशलिस्ट को दिखा दिया है,
हम्म
लोकल डॉक्टर्स को दिखा दिया है। तो
हम्म
एवरीवन रूल आउट द पॉसिबिलिटी ऑफ एपिलेप्सी, क्योंकि ईसीजी ईईजी रिपोर्ट सब नॉर्मल थे। सो माइट
हाँ
बी दिस है कि ब्लड प्रेशर उसका लो हो जाता है या फिर उसको हाइपोक्सिया है। नो वन हैज रीच टू अ स्पेसिफिक कंक्लूजन कि उसको प्रॉब्लम क्या है। सो इट कैन बी ड्रॉप ऑफ शुगर लेवल, क्योंकि उसको
करेक्ट
पसीना बहुत आता है। शी इज रिस्पॉन्डिंग, मैं उसको पूछती हूँ उर्वी क्या हो रहा है, चक्कर आ रहा है, तो शी सेज यस चक्कर आ रहा है, शी इज रिस्पॉन्डिंग। एंड
करेक्ट
ऑल्दो शी इज अ स्पेशल चाइल्ड, मतलब मैं उससे ज्यादा कम्युनिकेट नहीं कर पाती हूँ, बिकॉज शी इज नॉट एबल टू कम्युनिकेट इन बेस्ट ऑफ हर स्पीच, क्योंकि वैसे ही उसका स्पीच सब कुछ कम है। सो इनफैक्ट आई नीड योर अपॉइंटमेंट, मुझे आपसे पर्सनली मिलना ही है।
Get up on my appointment. What I'm saying is she could be having a different type of what we call stroke, a different type. It has nothing to do with what we spoke, where brain ka one part is not working properly, which might also be affecting her speech. One thing. The other possibilities which you said is usually told by doctors just like that. The low blood pressure रहेगा. Person cannot have low blood pressure all the time. They will have, it cannot become more lower, but if it can, then she has these episodes very often. जब भी होता है, they should check her blood pressure 2-3 बार. Every time if it becoming low, that means okay, that is the reason. Low blood sugar के chances भी नहीं है, correct? There is nothing else, nothing that can be explained because this is not typically any picture in the medical textbook, except for some brain anomaly, some problem with the brain.
Okay. And
I'm
can I associate with, sorry.
I'm saying this only because she has some speech difficulties.
Mhm.
If you have told me that she's perfectly normal, then I still won't even have that doubt. And 70% in medicine, we don't know. We know only 30%. So I cannot tell you what is the reason.
Sometimes I can associate this more with her periodic problem, with her menses problem. It happens more frequently when she is about to get her menses. So hormones can be a reason.
No, it has nothing to do with hormones. It is just that
Okay.
the hormone levels fall. That is the time when the bleeding will start. So because the hormones become less, she might be getting giddiness.
Okay.
First thing is next time you try doing nothing.
Yeah, I
Except
do nothing. I do nothing.
so
I'm helpless mother.
there is no pathology, no reason for it happening. And since you are saying 11, 12, maybe that's the time when her period started. And just before the period start, her hormone levels fall immediately, and that might be contributing to it. That's all.
Okay. So no ilaj for this.
I don't think so. Yeah, there is. If you want, they can do a lamba ulta and ulta thing. You can give her some medicines so that she doesn't get menses only for 2-3 months or 5 months, and then she should
No,
not
no,
get.
she's suffered a long history of PCOD. Now at least she started getting irregular menses. I'm happy with that.
Ulta. This is an ulta and a long thing, not correct method. And if you stop her bleeding and if she doesn't get these episodes, then you can conclude, yes, this is because of that. But it's not a correct
Okay.
method of doing.
So it's wait and watch situation. Okay. Okay, thank you, sir.
Oh. No, no, I
Sir,
think. Acha, others can. Okay, there's a question in the classroom only. So
so that the question gets recorded.
there's a question
Sir
from the
also has
classroom.
to talk.
Just talk.
2020, what happened? I was wearing a double mask. First, I was wearing N90, and then top of that dupatta, I wanted to bring medicine for my husband, who was unable to walk because of uric acid. I went to homeopathic doctor. While coming, I was feeling thirsty, but I went marketing since COVID is there, just marketing. And I did not drink water for a longer time. So when I came home, after 1 hour, after that also I did not drink water. After 1 hour, I started feeling my lips are going. Means I'm unable to drink water. Everybody started, yeah, okay, don't worry. But then afterwards, after 2 hours, my neighbor came and she's telling her face is looking crooked. Maria, your face is looking crooked, do something. Then I called my doctor. Doctor started telling me, do the exercise of the mouth. It's hitting you with Bell palsy. But still, next day they checked everything, my brain and all, nothing was there. But was there on the steroid for 8-10 days. And then an exercise, but physiotherapist. I got a physiotherapy in COVID also. MD only checked me on my photos that nothing is wrong with me. That was Bell palsy, not brain. But my hands and all are working. Only my face was going. Huh? That only. Miss, it is not brainstorm. Like
Okay, very good. So she was sharing her experience. What she's telling is something called Bell's palsy. That is not even paralysis. That is not the word paralysis. Let's say it is 50% of paralysis. And this happens only in the face because the nerve which is supplying the muscles of the face, that is affected. And that is called facial paralysis or Bell's palsy. Right? It is only one nerve which is affected. We have got 12 nerves coming out from brain. Out of that, only one nerve is affected. Right? So this is not exactly paralysis. And it is definitely not stroke. Okay? So she's asking a question out of that FAS pass. If one thing is not proper but other things are proper, still it means that there is 70% chances there is stroke. You don't have to have all FAS. Anyone is more than enough. Yes, that is what it is. Immediate treatment will prevent paralysis. Okay. because we have constraints of time, we'll go to the next topic. So choking. Choking means food going into the windpipe. And the rest of the word choke you understand. So there are two types of, so this all I have already told you, and you already know. Front is the windpipe, back is the food pipe. Food pipe is always closed until we are eating. And windpipe is always open because you have to breathe. Another thing is on top of the windpipe towards the throat, there is something called a voice box called larynx. In anatomy, it is called voice box. And unless we breathe out, we cannot talk. When we are breathing out only, we can talk. Okay. So if we don't breathe in, we can't breathe out. If we can't breathe out, we can't talk. So the problem is when we are choking, we can't even tell somebody I'm choking. That is the worst part. मरता है तो बोल भी नहीं सकता मैं मर रहा हूं करके. Okay, that you have to remember. So whenever there's choking, there are two types of choking. One is partial choking. That means if this is the food pipe, part of it is getting blocked. Our body tries to bring this out by coughing. Because coughing means air from the lung is coming out. It is trying to bring this out. Okay. At this time, what we do is we give people water to drink. When the person is coughing, water goes in the food pipe. Problem is in the windpipe. So don't give water. If you hit somebody on the back or on the head, that thing will fall down by gravity. It is not solving the problem. So don't do anything to that person. Tell that person, keep coughing. If you cough, you don't die. If you don't cough, you'll die. So let him cough. Simple. If it is complete choking, no air is going in, no air is coming out. So a person can't tell anybody that I'm choking. So if you see food and if you see somebody running here and there, then stop that person and do what we will do next. This person cannot talk. So if you ask the person, are you choking? And if he says yes, then he's not choking, he's joking. He cannot talk. He can only shake his head. So whatever else you're seeing here, do abdominal thrust. Abdomen word you know by now. It is medical term for stomach. So we have to put our hand somewhere like that and press hard and try to bring that out. Okay, now the word is press hard. So first see this video, then we'll go ahead.
First, ask if the victim is choking.
Are you choking?
If the victim nods that he or she is choking and cannot talk, you must act.
I'm going to help you.
When a victim is choking, you need to give thrusts slightly above the belly button. Kneel or stand firmly behind the victim and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the stomach. In a real situation, you would give thrusts until the object is forced out and the victim can breathe, cough, or speak, or until they stop responding.
Right, I'm going to tell you this in little detail because...
First, ask if the victim is choking.
Are you choking?
If the victim nods that he or she...
It's because we all eat food. Right? This can happen to us in our own house. That's why I'm telling you little in detail. Nowhere you saw that we call the doctor. Because by the time the doctor comes, we have gone up. Or whoever is choking has gone up. So don't call the doctor. You have to learn to do this yourself. Don't call ambulance. Don't call anybody. Okay? So as you saw, we make a fist. With left hand, right hand, no rules. Like I told you first. Place it, put the thumb inside, like unlike what they showed the thumb out. It comes in the way. So put the thumb inside. Okay? Put it above the belly button. That is above the umbilicus. One hand. Okay? So now I want all of you, even those who are at home, press on the soft part of your stomach in the center. And keep going up. Till you get one bone. Did you get the bone? Because this is the same bone which we are going to use for next topic, CPR. Wherever you got the bone, about 2 fingers, your fingers can be thin, thick, it doesn't matter. About 2 fingers is where we are going to place the hand for CPR. So you have to know where this bone is. So between this bone and the navel or umbilicus, put this fist. not exactly in the midline or anything, but on the soft part of the stomach. With the other hand, you cover this. So it is like this. I'm showing them inside. So cover the other one like this. Now you have to press not inside, because then you'll go only in stomach. Stomach pressure will increase. You can't push up because then it is in the air. So you have to push in and up. So I'm doing to show you in and up. So in is like this, up is like this. You have to go in between the two. In and up. So what happens is, okay. So when we do that, we are putting the pressure on the abdomen, which is going and hitting the lower part of the lungs. The pressure is transmitted on the lung. Air from the lung is coming out. It is going in the windpipe and is trying to bring that out. Okay? Things will never come out unless you use all the force in the world that you have got. All the force you've got in the world. Okay? So first you have to stand behind this person like you saw in the video, because that person's weight is going to fall on you because you are going to use all the force. So you're going to hug that person literally. So please take permission first. Otherwise their husband or wife will come and hit you and spoil the whole show. So first you have to ask, are you choking? That person will say, then you have to say, can I help you? You have to say like that and then do. Okay. Now how much force to use? How much force to use? Use that much force that you'll break these ribs. Break these bones which are down here. There is liver on the right side, damage it. There's spleen on the left side, damage it. That much force. Because if you don't use that much force, nothing is going to come out. It is not a simple thing. And if this does not come out, tomorrow anyway you have to put. You understood what I'm saying? He is going to die with nice bones and nice liver and spleen. But if you break them, he will be alive and tomorrow damaged, but tomorrow in the hospital and they can repair the damage and the person will be alive. So don't think that I'll damage it. Yes, please damage it and keep that person alive. There are 10,000 doctors and 10,000 hospitals to make him all right. But if you don't use force, person is already not breathing. Slowly that is going to stop all the breathing. No oxygenated blood is going to the brain. Person is going to become unconscious. Person will fall down. You will have to do CPR. And if he comes out, good. If he doesn't come out, death. Here chances of coming out are less because something is blocking. In CPR, we have to give breath. That breath is not going to go in. And therefore use all the force while the person is still alive. Okay. Now 2 or 3 different things. If the height does not match, and suppose you have to give to madam. Madam is quite tall. So if you put like this, then your hands will go on her thighs. Or if it is a child and you do like this, it will go on his head. So always you have to adjust the height. Either tell the person to kneel down or you kneel down. Never make anybody stand on a chair, table, because if you're really using the force I'm telling, they will fall from the table or chair. So they have to be on firm ground. Okay, so you kneel or make that person kneel. So that is what they in the first line. If the height does not match, then you kneel or tell that person to kneel. Height is matching, but stomach is not matching. The lady is pregnant or that mithai ki dukan ka sethiya. So you can't put your hands. Okay. Then simplest thing, in pregnant lady, please don't attempt. I'm saying please to you, don't attempt, because this might not come out, but that child will come out, which is still worse. So in both cases, do like we do in CPR. Simple. Okay. Same position like CPR, do like that, and that will help. In very small 1 year till 1 year age, they are called infants. The method is little different. If we have time, we'll see all the videos in the end. Otherwise, you can see these videos on YouTube. Now I'm skipping this whole trauma accident part and I'm going directly to CPR. And then we'll come back and do that and only the important things. If you don't mind sitting till evening, I don't mind. But you have to give me lunch also. So CPR stands for cardiopulmonary resuscitation. Resuscitation means revival. Please don't learn the full form. I'm telling you, please don't. Because if you go in the shop and tell that fellow, give me light emission diodography TV, he'll say, ऐसा TV हमारे पास नहीं है. You tell him LED TV चाहिए, he'll take out and give you. So something the best known in their short form. Okay. If you're going for a quiz competition, learn and go. Others don't bother. Now, this is called mechanical activity of the heart. Can you see the heart is beating? To be more precise, left side, you see the blood is coming in, blood is going out, heart is contracting. First the upper part, then the lower part, and that is called mechanical activity, like the fan going around. This is happening because the electric current is coming red in color and spreading to the heart. When the electric current comes, if you see down, you can find out this current on an ECG paper. Then you can see ECG is being formed because E of the ECG is electric, C is cardiac. So it is the current which is there in the heart. It can be traced on a paper, and that's why it's called ECG. So that is electric activity. This is mechanical activity. One of the two becomes absent or both are absent. Medically, the condition is called cardiac arrest. How I identify it is the person is unconscious and not breathing. And how anybody in the world identified is Yamraj is sitting on black buffalo, but in the corner. He's not come down. Okay. Now we tapped on the shoulder and asked, no response. We looked at the chest, no breathing. Next, without thinking, we start CPR. Then Yamraj will not get down. If we sit to talk, Yamraj will get down. And if Yamraj gets down, nobody can do anything. Okay. So what is cardiac arrest? If you want to understand, it is the end stage, last stage before death. Okay. Where the person's brain has stopped working, that's why he's unconscious. Person's lungs have stopped working, that's why that person is not breathing. And heart is about to stop. Heart is almost about to stop beating. Okay. Or it has happened. We don't know exactly, but it is happening. That is what it is. So when does cardiac arrest occur? So cardiac arrest is any stage before death. So if a person has to die without us doing CPR, then any reason for death before that will be cardiac arrest. So if I go out of this room, the person is going to die. So till this door, there is cardiac arrest. That side of the door is death. So how a person will die with what condition? Anything. So if bullet injury, accident, any disease, like say COVID, okay, complication of any disease, complication of any surgery, labor, diarrhea, burns, anything in the world will call, everything in the world will cause cardiac arrest. So last stage is cardiac arrest. That means we are very sure if we don't do anything, this person will die. So can heart attack also cause death? No, people die with heart attack, no? So some people in heart attack will, as a complication, get cardiac arrest and die. But everybody of heart attack is not cardiac arrest. So that is the difference between cardiac arrest and heart attack. Some people with complication of heart attack will die and then they go through cardiac arrest. But everybody who gets heart attack is not cardiac arrest. Clear? So all those are the causes for last visit. We'll answer that question in the end. Okay? So little theory, maximum practical. CPR has two parts. One is you have to press the chest. And one is to give breath. C part cardiac, P part pulmonary. Okay? So skipping this slide, I'm going to the next slide. There's a backbone behind, red in line. There's sternum bone in front, 2 bones. Make the person lie on a flat, hard surface before giving CPR. Flat, hard surface. So no bed, no sofa, no back seat of the car. Otherwise, only that mattress, sofa, or the back seat will get CPR, person will not get. Okay? So if the question is that I want to give CPR, I can't move the person from the bed down. Put something hard below the person, like a board, or you fold this table and put something. But don't give on a soft thing, useless. As might as well as not give. So now if I press my hand which is on the sternum will go down. Correct? But behind nothing will go down because there's flat ground and there's a backbone. So whatever heart is there in between this will get squeezed. So all the blood from the heart will go out. That is called chest compression. If I keep like this, heart will remain empty. So after pressing, I leave the pressure. So that is called recoil. Chest is recoiling. Correct? And then again the blood from the body will come and fill up in the heart. Again I'll press this down, blood will go out. This is what heart is doing as a pump. So I am doing that person's heart's work from outside. And I'm starting circulation. Artificial pump. And my interest is to give brain, because after 4 minutes of loss of blood supply, brain damages permanent. And this cannot be turned back. It's a permanent death. So my aim is to send the blood to the brain. If it doesn't go to my legs and hands, I'm not worried. So we say, technically, I'm trying to establish central circulation, lungs, heart, and brain. Central. If it doesn't go to the periphery, forget it. हाथ काट के फेंक भी देने का तो कल फेंक देना ना, आदमी तो जिंदा है. That is important. Okay? Clear? So I'm trying to establish central circulation by pressing, releasing, pressing, releasing. How fast do you think I should be able to do this? How many times in a minute? As much as the heart works. Na? We are doing heart's work, so we should do it at the same speed that the heart is working. So heart rate is something maximum about 100. Simple way to remember. So yeah, this they will not be able to do. Maximum is about 100. Okay. So you have to press around 100. If you don't remember anything, 100 is a good figure. But in 1 minute, 100 times per minute. Okay. So you have to press. How many times we finished? How much to press so that blood goes out? So you have to press at least 2 inches. Minimum. 2 inches is the best. But if not, at least 2 inches you have to press down and release. And press and release, and press and release. 100 times in 1 minute. Are you understanding? Right? Let's go and see. So chest compression is an attempt to restore the blood circulation. Okay, when we press, blood will come out. When we leave, the blood will come back. We keep doing this. Then there is blood without oxygen circulating. So sometime in between, we'll have to stop and give breath. Correct? So that oxygen goes into that blood. Okay? If you're thinking that we expire CO2 and inspire oxygen, wait till we see some slides. Okay, the whole aim is to keep brain is in red color, brain, lungs, and heart with blood supply. Okay? So this is CPR, doing CPR. Now we can do CPR for minutes, hours, days, weeks, months. This person is not going to get up and say thank you. Why do CPR then? If you don't do CPR, that person will die in this room. Now you want this person alive to reach the hospital, so that once he's alive, the doctor can do something. So to keep that person alive, we are doing CPR. We are only extending his life. We are making his life long by doing CPR. so that he reaches the hospital as a live human being. Otherwise, if you don't do CPR, he reaches the hospital and they say, "वो सामने स्मशान घर में लेके जाओ." Understood? That's why we are doing CPR. You must have read every day in the paper. This happened, that happened. Then he was taken to the hospital. In the hospital, they said he's already dead because they didn't do CPR. Therefore, it makes a difference between life and death. First slide which we had seen. It is your work which is going to make the difference between life and death because you are going to give CPR. Correct? Doctor is not going to do anything. If you send a dead person, doctor can't do anything. You are the one who's saving the person. Right? So now we'll learn two things: how to give compression, how to give breath. End of the story. So coming back again to this slide only. When will this person get up? So after he reaches the hospital, you must have seen in some movies, or I'll show you in the slide, doctor has a small history-like thing they put here and they give what is called shock. But shock is to the heart, not to the person. आदमी को शॉक देने का तो उधर उंगली डाल के स्विच ऑन कर देगा तो हो गया. So we are giving shock to the heart. Now in America, they said, take the person to the hospital, then do that. Why not get that machine here and do? इधर ही कर दो ना, तो मरने का सवाल ही नहीं आएगा ना. That is called defibrillation. Why that word? Forget. But that is called defibrillation. That process of giving shock to the heart is called defibrillation. So everybody is not a doctor, so we don't know how to use the machine. So make an automatic machine, which the machine itself will give shock. And therefore that machine is called automatic external means outside, defibrillator, and then its short form is AED. AED. Okay. Therefore, in America, wherever 200 people collect, there has to be an AED. In our country, even if 2 crore people collect, there is no AED. Am I clear? When we go to AED, we'll again talk more about AED. So this is how we are doing compression between two heart bones, and that's why the blood will be squeezed out. Okay, step 1, check response, which we have already learned. Then call ambulance. Suppose you're looking at the breathing and you don't want to hold the mobile and all, put it on speaker and keep talking, and you keep looking at the chest. Okay. Why you have to talk with the ambulance people? Because you have to give them address. You have to talk with them. Plus you have to tell them, especially if your place is on a one-way street, they can come directly opposite. So you have to tell them it is a one-way street, ulta aa jao. Then you have to tell them landmark. ICICI बैंक के सामने, नहीं तो पूरा हनुमान रोड घूमते रहेगा. कहाँ है वो? हाँ. Landmarks also. All this you talk. In the meantime, you look at the chest. Chest is not moving. Put the phone down. You can talk on the speaker. You start CPR. That is what is written there. Put phone on speaker and continue. So this is you're looking at the chest, old slides, repeat of the slide. The good old days, we were doing ABC, like in KG. KG we do ABC, na? And D for defibrillation. So ABCD. Then we found that you saw in that thing that first they checked and then they opened the thing and gave a breath and all. Now also we'll see that same thing, old thing. Now we don't do that. We just directly take out the clothes and start CPR. That is chest compression. Then we'll open the hawa ka rasta. Airway we will open and then we'll give one saas. That is breath. So it becomes CAB. Because blood moving is more important rather than giving a breath. You give the breath, you give oxygen, but the blood is not flowing, what's the use? So first make the blood flowing, then we'll give breath. So we have changed it to CAB. Okay. Now how to give chest compression? Where to give chest compression? So in males and children, draw a line between the nipple, put your hand and do it. How to put, I'll teach you. In females, you don't go by the nipple. So you go again by this method. Feel the bone, about 2 fingers. Go about 2 fingers, 3 fingers, whatever you remember. Don't say, oh, I forgot how many fingers, now I'll not do. Do it. Okay. So I'll jump one slide and then we'll come back. Step 1, 2 hands are there. Correct? Any hand you take, left or right, first you put it like this. Okay. So then the other hand goes on it like this. This can slip like this. That's why we'll do just locking. And this will be it. We are only going to put the heel of the hand on the bone, huh? Not the whole hand. Otherwise, we might break these bones. And even if you break, no problem. Break them. Break them. सबकी हड्डी टूटती है, ठीक होता है. जितना तो रखा ना आदमी को. ऐसे भी अच्छी हड्डी रख के कल माचिस लगाने का फायदा क्या है? So break. But then remember this. This is how it will be the position. Not this. This. Only the heel. हथेली, हाथ की हथेली बोन के ऊपर रहेगी. Yeah, so we do like this, no? You come from here, you felt the bone about 2 fingers ऊपर रख दे. ये 2 fingers above from the lower end. Now this is where my hand is. Got it? Okay. You have to remove the clothes. Don't feel lady hai, can't move. There are buttons, zips, some decoration thing. Is that your hand will pain immediately. So you don't know. Thus, you should know whether you are put on the bone or not. Otherwise, you put here and do, you are not touching the heart. So remove clothes, look for it, place your hands, now cover it with a dupatta. Simple. Okay? In the meantime, all will see. So anywhere you want to give privacy to a lady, even in the middle of the road, you tell 5 people stand facing that side. Suppose person is lying down here. Ye sira ye pair hai. One man stands like that. Man also. Man stands looking there. Another man, third man, fourth man, fifth man. It is so. It is like this. The lady is lying here. They are sitting that side, so they can't. Simple way. Then cover with dupatta or anything over your hand, not under. Upper. Continue with CPR. Okay. So this is how we are going to put the hand. And this is how the hand will be placed. How it looks from front, how it looks from side. This is how it is. So we kneel on one side of the person. We are kneeling down. Okay. And then we are putting our hands like that. In the second diagram, you can see very clearly. The person has knelt and they have put their hands. Okay. And now we are going to press. We should press at the rate of 100 to 120 per minute. If you don't remember figures, तेंदुलकर को याद रखना 100 मारता है वो आपने कभी 100 मारा तेंदुलकर you know. Yes. Then how much down you have to go? 2 inches. 2 inches in centimeters is 5 feet. ये सब कहाँ से याद है यार 5 feet. So compass box के अंदर we have that small ruler 6 centimeters or 6 inches. 6 inches. 6 inches. वो आधा रूलर कितना जाने we are never going to go. So you need all the strength in the world. Okay, right? And then you go 2 inches, and then every time you press down, you have to leave it and come up. That is called recoil. And avoid interruption. अरे किसका कॉल आ रहा है? हाँ क्या हुआ? Right? So they said that सिर खुजाने के लिए भी नहीं छोड़नी. Don't even do to scratch. You have to do CPR. Clear to here? After you are doing this compression, this is the same thing, 2 inches pass, allow recoil, minimum interruptions. See this something near the patient's shoulder, white in color. It is a mask to give breath. So just see, I will show you again after. Now we are doing compressions. How many compressions to give I have not told. How to give I have told. Now when the person becomes unconscious, tongue is a big muscle that also becomes loose. So you see that white line which is going from the nose to the windpipe that has got blocked by the red color tongue. Okay. Then if I lift the chin and push the head like this, then it has opened up. So that is called head tilt, chin lift. Words you forget. How you will remember, I'll teach you. So this is called head lift, chin lift you do to open the hawa ka rasta. So now we have opened the airway. After opening the airway, we'll give breath. So now I'm showing you different ways how to open the airway. Exactly like this. and like this. We forget, huh? Human beings. बोला था पर ऊपर करने का नीचे वो तो मैं भूल गया. Naturally. So when we want to take some nice smell, we are talking about airway, na? हवा का रास्ता. If you want to take some nice smell, we do like this. Correct? So left side mein that fellow is very active. So every morning he was running. So this is called morning air sniffing position. बड़ा वर्ड्स है, शॉर्ट में इतना. ये वाली जरा लेजी है, तो कॉफी का स्मेल ले लेती. But method of taking the smell remains same. So this is the position you'll put the head in. Now we have to give breath. Okay, so go to the bottom line. We are breathing in air and we are breathing out air. The air we breathe in is containing 20% oxygen, and the air we breathe out is containing 16% oxygen. So we can still give technically 4 people oxygen. Barabar? Because we have used only 4%. So whatever we learned in school was little wrong. We breathe in oxygen and we breathe out carbon dioxide. We breathe in air and we breathe out air. If we were breathing oxygen only, COVID में oxygen की जरूरत ही नहीं पड़ती ना. Correct? So that is the thing. So we go back up. How to give breath to this person? Either you put your mouth on their mouth and blow. Give breath. Okay? So it looks nice in the movies. Heroine brushed teeth, put powder and came. Hero doesn't have any problem. You want to put that person's tooth is broken, is bleeding, either say vomit आया है, मुंह में से बास आ रहा है. Don't want to put your mouth. Okay? So then what we will do is we'll use this mask. This is mouth to mouth. When you're giving breath mouth to mouth, you put your lips on that person's lips, but you have to do head till chin lift. There's हवा नहीं जाएगा. You ऐसा करके रख दिया फिर breath दिया तो no use. You have to still maintain head till chin lift. So you see his hand is on the forehead. These 2 fingers are closing the nose. Otherwise air will come out from there. And with the other hand you lifted the chin. And then you put your mouth on that person's mouth and do this. This is very nice for your own family. Okay? रास्ते के आदमी को नहीं देने का. रास्ते के आदमी को देने का है तो you have to use what is called a mask. So that what that lady is breathing, that is called a pocket mask. It is not any mask that we use for COVID. It is not a mask even that is put on the hospital on the person's face. This is a different type of mask, right? And you give breath through that. You can sit on the side or at the head end. It doesn't matter, but you give. Now, how many breaths or how we give breath? So whatever method you use, give 2 breaths. 1 breath, correct? Take out your mouth. Otherwise, that person will breathe and you will inhale. So you are now taking 16 again. Give foo, take out your mouth. Again, bend down, foo, take out your mouth. When do you, again, I'll come back to this slide in 1 minute. So the chest compression and ventilation ratio is 30:2. So you give 30 compressions, give 2 breaths. So we are doing like this 30 compression. I move to the head end. I do head till chin lift. Either I close the nose and I give the breath, or I put the mask and I give the breath. How much breath to give? We don't have to do like how we take deep breath in yoga and then do pura, because when we are breathing, uska speaker on. The person next to you is breathing. You can't see their chest going like that, na? You don't have to make this one's chest also go like that. So you don't have to do पूरा जमा करके करने की जरूरत नहीं. You just give normal breath. Best way to make out whether the breath is gone in or not, chest should rise. Every time you do foo, ये थोड़ा ऊपर आएगा. नहीं आया तो you don't blow balloon. नहीं करने. That is called blowing the balloon. That means you didn't do head till chin lift properly. That is the whole reason. Otherwise, hair will go in. Okay? So this is how we give 2 breaths. Trying. Breath is not going in. Don't break your head. 10 seconds is the maximum interruption time allowed. In 10 seconds, again start chest compression. सांस नहीं दिया चलेगा, सांस नहीं देने का, I don't want to give breath, go on doing compression without interruption. Suppose I don't like to give some breath to this person. There is no pocket mask. I don't want to give. Okay, don't give, do compression. Air is, blood is flowing, na? That is our name. That is called hands only CPR or CPR without giving breath. So, you're going to give 2 breaths, either mouth to mouth or with a pocket mask. If it is available, pocket mask therefore should be there in first aid box. Then it is always available. Ratio is 30:2, 30 compressions, 2 breaths. Now this is to be done for 5 minutes, or 5 cycles. Means 30 and 2, 30 and 2, 30 and 2, 5 times in 2 minutes. Don't do maths. People have done properly. It is done. After 2 minutes, whether we drink Bonvita, Horlicks, whatever, we cannot do. Meaning we can do, but it will not go 2 inches or it will not go at the speed of 100. So it is useless. So after 2 minutes, somebody else has to do. Therefore, we teach many people at the same time. But in our house, we are the only one who has learnt and come. Then what to do? So then you have to teach while you're doing in the first time. You have to tell your family, must see how I'm pressing. See, I'm going down so much and I'm coming up. I'm doing like this. You have to do like this. What they will tell? No, we are not doing. We are going. All will go out of the house. Come here. Let grandmother die. You have to just emotional blackmail. Grandmother will die. So then somebody will think, okay, chalo, try kare. So you have to teach them in the first round. They don't know how to give breath. Giving breath is all right. Now you don't need exertion. We can go on giving breath. After 2 minutes, you take over again. Again, after 2 minutes, they will take. It has to be a cycle. Because that ambulance will come after how many minutes? Who is going to do? We can't do for 15 minutes. So 2 people, 3 people will go on doing. Okay? Understood? Now, this is how you do chest compression in adults. 2 hands. Children, 1 hand is enough. Because our aim is to go down 2 inches. But who's a child? 10-year-old can also be a child. 2-year-old can be also a child. So 2-year mein 1 hand will be enough. But 11-year-old and that too, if he is going to McDonald's every day, then 1 hand is not enough. Then you have to use 2 hands. So your judgment. But in infants means less than 1 year, you use 2 fingers like this. On the same bone, but 2 fingers. Tip. When you are doing this, because you have to press. Okay? But then there's another method, 2 thumbs also. When you're using 2 thumbs, then don't use tips. And don't keep the thumb like this, because heart is not like this. Heart aisa hai na? So you have to keep fingers like this. You use pulp of the finger, no problem. Both are all right. Okay? Both are all right. Don't worry. Okay? Only 2 fingers. Not children, infants. See, child is in the middle, 1 hand. Infant is 2 fingers. Okay? So that is for children. Rib cage is drawn for us to understand. Okay? And this is for infants. Right? Understood? Now we'll see a video of CPR.
First, make sure the scene is safe for you and the victim.
The scene is safe.
Tap and shout to see if the victim responds.
Are you okay? Are you okay?
If the victim does not respond, yell for help.
Help! I need some help here.
If someone comes, send him to phone the emergency response number and get the AED.
You, call 911, get an AED.
Then open the airway with a head tilt, chin lift. Check to see if the victim is breathing normally. Look, listen, and feel for breaths. If there is no normal breathing, give 2 breaths that make the chest rise for 1 second each. Quickly move or remove clothes from the front of the chest that will get in the way of doing compressions and using an AED.
4, 5, 6, 7,
Now, give
9,
30
10,
compressions.
11, 12, 13, 14,
Remember to
15,
push hard
16,
and push
17,
fast.
18, 19, 20, 21, 22, 23,
Let the chest
24,
return to normal.
25, 26, 27, 28,
This is
29,
opening
30.
Then,
And now we are
give
going
2 breaths. When you give
Doing
breaths,
wrong.
watch for chest
Every
rise.
breath you have to lift his head.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, you got the idea. We'll stop the video.
Query.
Yeah, after 2 minutes, after 2 minutes.
Okay.
This will get over in 2 minutes. Then the person has gone to the hospital. This is called a defibrillator machine, right? And those things that you're seeing where I've labeled them as paddles, that small iron-like thing is trika chest. That is what on the next slide you'll see. This is placed on the chest like that and the heart is given shock. Okay, this is called defibrillation. In medical, this is called defibrillation. Since the doctor uses it, it's called a manual defibrillator. Don't worry, it's called defibrillation. Like I told you, in America, they found that why take the person to the hospital? Person can die on the way. Therefore, they made automatic defibrillators. They are called AEDs. Red one is the box. From that, we took out that blue gray one, which is below it. That is the actual AED machine. Attached to the AED machine, you see there is a gray color box from which on the right hand side top, you can see that there is something like pads, and we'll see all this together. All the other things that you're seeing are extra. Once we open the AED machine, such 2 pads will be available. There are markings on the pad as to where to stick the pad. So there is a sticker like thing. You remove the sticker, take the pad, put it on the right side below the collarbone or clavicle, and left side you put it on this side of the heart in this armpit line. Okay. They are big in size, so you don't have to know exactly 2 centimeters, 5 centimeters upar niche hua, so there is no problem. Connect the pads to the machine. Leave the machine, it will do all the rest. Like you put the clothes inside, put the soap, close the lid, press the button. You don't have to do anything. Machine will wash the clothes, dry the clothes, and then it will tell you, you can take the clothes. Same way. This is called an AED, right? So we'll see a video of exactly how the AED is going to work.
Adult AED.
Here, of course, he is going to say take out clothes and all because they have not started CPR.
Defibrillation. Automated external defibrillator. AED. Turn AED on and follow the voice prompts.
So once you turn the AED on, AED will talk to you.
This is a training device only. No shock will be delivered. Remove clothing from person's chest.
Because that pad has to be stuck on the bare skin.
Attach pads firmly to person's chest as shown.
See, those are the 2 pads. Stripped out one pad, put it in the left armpit line. Another one below the right clavicle.
Plug-in connector.
Now the pads have to be attached to the machine.
Check connector and
Everything is
pads.
helpful, you know, they'll say where the light is blinking. Attached.
Analyzing rhythm.
Nowadays, it already
Everyone
comes
stand
attached.
clear.
Now the machine is trying to find out how the heart is beating.
Shock
That is called
advised.
analysis. So you don't touch.
Charging.
Now
Everyone
decided
stand
it has to
clear.
give a shock. So it has charged. Now deciding,
Everyone
deliver
stand
the shock.
clear. Push
See
the
that
shock
nobody is
button.
touching. Then you push the shock button.
Shock delivered. Begin 5 cycles of
Now you
CPR.
will do CPR. Don't remove the pads. Pads will remain as it is. Don't disconnect the machine. Machine will go on making a noise. If you have spent less, machine will make a more noise. Ting, 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 ting. That is your speed to do CPR. If you have spent more, then machine will tell 1, 2, 3, 4, 30 compressions over, give 2 breaths, everything it will talk.
1 minute and 30 seconds of CPR remain.
Only 30 seconds I've finished. Okay? So like this, it will go on for 2 minutes. We don't put
Continue
on the
to
machine,
repeat
we don't
30
take out the
chest
patch.
compressions and 2 rescue breaths until the AED begins to reassess the rhythm.
At the end of 2 minutes, it will say again, analyzing.
Analyzing rhythm. Everyone stand clear.
The AED will continue to give you directions on exactly what to do.
So at 2 minutes when it is analyzing, if we have touched it, then it will analyze our heart and say everything is beating nicely. So nobody should touch. When it is saying give shock, before pressing the shock button, nobody should touch. Otherwise, everybody will get little shocks. And the problem is the main person won't get enough shock. So nobody should touch 2 times, analyze and giving shock. So you have to put on the machine, attach the pads, it will analyze, we don't do anything. It will decide whether to give shock or not. It will tell us only press the shock button. I want to give her shock because she didn't listen to my lecture. That machine will not give. Because that machine will find that her heart is working properly. So I cannot give shock even if I want to give. So if the machine says no shock, you cannot give shock because it will not give. Because it has got a computer in it. Okay. This machine costs around 1 lakh rupees. Now in India, it's available for 80, 90 also. This is kept in such a place in open so that anybody can take it out and use it. It is not put under lock and key. In our country, even if the government keeps, people will take home. Correct? Not only that, they will sell it also for 50, 60,000. And there are people who will buy it also. लाख का चीज 50,000 में मिलता है तो क्यों नहीं लेने का, लेगा. इंडिया है. Rather they'll teach people how to rob and bring and give me. So that's why for all those who are city of Mumbai, this is available nowadays in few malls. In selected malls it is there. It is not there at CST. It is not there in Dadar, Borivali, Thane, nowhere. Railway station. Churchgate railway station on the first floor in assistant station master's office it is there. But under lock and key, but usually assistant station master is always there on duty. Okay. You'll get this in all MNCs. There are 100 between the 2 airports. But first you have to buy plane ticket, then get cardiac arrest. Okay, every plane has it. What happens in America if a person dies and they claim insurance? Only question asked is, was an AED used? If the answer is no, no money. So that's why all MNCs where Americans come, foreigners come, there is an AED machine. All 5 stars, 4-star hotels will have. Okay? Right? Clear about AED? Okay, somebody wanted to ask a question.
Yes, sir. I just
One second. Just finish the slide. Steps for AED is put on the power. Then the AED will automatically tell the steps. That is the first step. It will tell attach pads as shown in the diagram. Then it will say analyzing, so stay clear. Then if it is shockable, it will power on, charge, and then red light will come on and it will say deliver shock, deliver shock. The best part of it is whenever step 1 is not done, machine never goes to step 2. So when you put it on, it says attach pads. If you don't attach pads, it will not go to step 2. So it's like a very faithful wife. Wife will go on telling the husband, do this, do this, do this. Because the husband doesn't do, so she tells 10 times. Machine is like this. Right? Then I'll just see if there's next thing. No. Okay, this is the last thing. So, no, we won't do this. We'll do this in the end. Go ahead, ask your question.
Sir, I just wanted to check in the CPR video. They did a 30. He gave 30 strokes and of compression, and he was giving this. But in the slide, which
in the video, what you said?
He was giving 30 compressions. Yeah, and then he was giving the mouth to mouth. So my question is, you had mentioned 100 per minute. So is it 100 or do we have to give?
Slowly. 30 are compressions. You can give over 1 hour. You can give over half a minute. So that is a rate. Rate should be at the rate of 100 per minute. So when we are doing this, the rate is that much. And how many number? That is at 30 you stop for giving breaths. Am I clear? Yes or no?
Slightly confused here.
Yeah. So you can do 30 compressions in half a minute, in 1 minute, 2 minutes, or 1 hour. 30 compressions are to be done, huh? Correct? Each compression should be done at the rate of 100 per minute. So now it is a 2-minute thing which we are dividing by 5 cycles. So 2 minutes is 120 seconds divided by 5. Okay? That out of that again you do that one cycle of 30 compressions should be over in so many seconds if you want that way. Am I clear? See, the speed limit written on the side of the road is saying 40 kilometers per hour speed. Whether you drive at 20, whether you drive at 30, or whether you drive at 40, that is different. That is your driving. But the speed told to you to drive is 40. So the speed with which we will give compressions is 100 per minute. Number of compressions which we will give is 30. One is the speed, one is the number. Okay?
Yes, sir.
Not only 30 times will you press the chest down. 30 times the chest will go down and come up. So if you take 120 per minute, that means in 1 second you will have to do 2 times chest going up and down in 1 second. That speed, that is the speed of the heart beating. So from now onwards, conserve that heart and keep, because it is working so much. And we are doing that person's heart's work from outside. So some amount of error is going to be there. And that's why we do that much speed. Okay. Did you understand that's this much?
Yes, sir.
Okay. Any other question?
Yes, sir. I have one question.
Go
Can
ahead.
I ask? Yeah.
Yeah, go ahead.
If strong genetic history of heart attack past 3 generations, so what will you suggest for the new generation to early prevention or
Nothing like that. That is beyond the scope of this lecture. Forget it. Now let's do more important things, right? And one question was there from the class that if that person has been operated on the heart for anything in the world, any disease in the world, including previous heart attack and stent placement also. Now my question is, there is a knife which is sticking out from the chest right next to sternum where we are going to do compression. Next is there are burns covering the whole of the chest, skin has come out. Okay, will you do CPR or not do? If you don't do, person will die. So the only reason for not doing CPR is if you want to kill the person. There is no contraindication to do CPR. Only one contraindication is there. If the head is on one side, body is on the other side, don't do CPR. That means when you know that this person is 100 out of 100 times dead, then don't do CPR. Otherwise, you have to do CPR in everybody that you want to save. If you're their enemy and don't want to save, don't do. That includes pregnant lady also needs CPR. Correct? Try to save her, then the kid will die, no problem, because mother if is alive, he can have more children. If you feel that the mother will die, you can't do anything. Continue and do CPR and tell the hospital that we are bringing a pregnant lady, be ready to do a cesarean and save the baby. But you have to do CPR and you have to give shock. Even in pregnant lady, you have to give shock. Huh? So pregnancy does not rule out anything. There is no condition where you will not do CPR. If the person has fallen on his face and stomach in an accident on the road, and if you feel this person is not breathing, okay, though without turning the person, it's difficult to say, but you feel that this person is not breathing, turn the person and start CPR. There, my previous rule that don't move the person is cancelled, because life is more important than anything else. Okay, does that answer your question? Does that answer your question? नहीं इधर इसने क्या पूछा था? हाँ बहुत. Okay, so I'm going to the next topic since you're not asking any questions, and that is trauma injury. It's almost 2 o'clock, so I'll only do one thing called bleeding. How to stop bleeding. Rest of the things we will not be able to cover. If bleeding gets over, then maybe burns. Okay, whenever there is any type of trauma, the person will bleed. Important is bleeding outside and bleeding inside. Bleeding outside we can see, we can stop. Bleeding inside we can never stop. So I'll lay more emphasis on that part of the thing. Whatever is there will kill the person. Stopping bleeding is the most preventable cause of death. Because if you stop bleeding, that person will remain alive. To stop bleeding, you only apply pressure. No haldi, no nothing in the world. Okay, we'll do little fast. Make sure there is no danger to you and the person. Blah, 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 blah. Take any clean cloth. Any clean cloth. Right? The ones that we use medically, that thing is called gauze. And what we are going to use later is called a bandage. So I'll show you that and we'll do that. But you can use any clean cloth. If clean cloth is not there, use a dirty cloth. Use a cloth, no cotton, cloth. You want to protect yourself against that person, wear plastic bag if you don't have gloves. If you don't have gloves, use a plastic bag. Okay? It's 2 o'clock in the middle of the road. You're seeing a person has met with an accident and that person is bleeding. All shops are closed. You can't get a clean cloth, plastic bag. What will you do? Take out a ganda bag from the kachra, put it on your hands, 2 bags, and don't touch the blood of that person. You can always wash your hands. What was the kachra in the plastic bag? Somebody ate some food and threw skin of some fruits. That only, na? Real kachra was there. Still what? Wash your hands afterwards. But don't come in contact with that person's blood without barrier. Am I clear? So you have worn a plastic bag. If there are no gloves, you have taken a cloth and press the cloth. Okay? You go on pressing it till the bleeding stops. This is called a gauze. Okay? You will come. Come here so they can see your hand. Time is short, only things happen wrong. When time is short, things happen wrong. No. Can you see your hand? There. Can you see your hand? कौन सा स्लाइड नहीं दिख रहा है? Just check ना. Just check. उसका हाथ दिख रहा है क्या? Okay. So you are bleeding from here.
Sir, I can't see, sir. Could you please? Yeah, now I can see.
Okay. So she is bleeding from here. I have not worn gloves yet. I've got a lot of gauze. So I'm telling her press. It is her blood only. Let her get infection. Press. Okay. Now I'm wearing gloves. I've worn gloves. Now I'm taking more and I'm putting here. And I've got support. Okay. And I'm trying to stop the bleeding. In between my fingers, I'm seeing it's still red. This has become red. So that means she's still bleeding. So I'll take a little more, put on this and press. Okay. Now I can't see anything red in between my fingers. That means bleeding has stopped. Okay. Now I can't go with her everywhere like this. So I'm going to put a bandage on this. Understood till here? Right? So, see in this, no, don't go. See in this, the person has already worn gloves. So, he's pressing. Other gauze is put, that has also become red. Then I have shown you when it becomes red, it is still bleeding. When it is not red, that means bleeding has stopped. Now what we have to do is we have to put a bandage over it. Okay, so this is called a bandage. So I said don't go. Okay, now whenever we put this, after this was put and it became red, okay, then I will never remove this. I will never remove this and put new one, because it is between this and this that the clot is forming. So these will always remain. I'll put more on top and press. So even while tying the bandage, we never remove this. Okay, we never remove. I'm removing only to show. So my first roll of bandage will go such that it is partly on the skin and partly on the gauze. I hope you can see this. No, they can see what? Huh? No, there. Dhananjay, just go inside and see whether you can see on the screen.
Yes, sir, we can see.
Yeah.
Perfect.
Okay. After you have done 2 times, this is called anchoring the bandage so that it will not slip. Then what we do is we don't go on the same thing again and again. Slowly we will go little up. So now I've gone little up. Okay. The next time I'll go again little more up. So this is called a spiral bandage. So see in the slide you can make out. Just wait sometimes. So you see in the slide you can make out it is going slowly up. Right? There are 2 things that you have to follow. You always go from a narrow part to a broad part. Never from broad to narrow, otherwise the whole thing will slip and come. And you have to go spirally, that is little up. After that, at the end of it, what you do with this bandage is your problem. How you put it, you put a sticker, you put a tape, anything, put a knot, do whatever in the world you like. But if you have lot of bandage at this end, you will say, paisa diya hai, वापस नीचे लेके जाओ. No. Then you are coming from broad to narrow. So it is wrong. You have to stop the bandaging here. Okay? You all saw all that? Those who are seeing online, please answer.
Yes, sir. Yes.
Just pull it out, take them. Okay? Now, if the bleeding does not stop, this is very nice. I took it for granted, bleeding is stopping. And then if the bleeding doesn't stop, what do you do? So first is elevate. If it is hands or legs, elevate. But before you lift the legs, see that the person is lying down. Huh? Okay. If it is anywhere other than hands and legs, you can't elevate. Another thing to stop bleeding is you put a pressure bandage. That means the bandage goes round and round and round and round with lots of pressure so that it will stop the bleeding. Because the only way to stop bleeding is by pressure, not haldi. If I ask why haldi, correct? Then in Ayurveda also haldi is used as an antiseptic. It is not used as an anti-bleeding. Blood clotting property is not there in haldi. Plus, you manage to put 200 grams of haldi. Now you go in the evening to the doctor and ask, doctor, ये कभी ठीक होएगा? कितना टाका मारने का है? इंजेक्शन देने का है क्या? दवा कितना दिन लेने का है? डॉक्टर बोलता है मैं 200 ग्राम हल्दी देख रहा हूं, निकालूंगा तो बात करूंगा. Again he'll take out everything and again it will start bleeding. So don't put anything. No haldi, no grease oil, no cotton, no coffee powder, nothing. Just stop bleeding and put a bandage on it. Let the doctor do his work because his wife is also there. She's always asking for gold chain. Let him also work. Okay. So this is called a pressure bandage to stop bleeding. So stupid question is why do we need pressure bandage when we can do the method you showed? So a person, somebody was trying to hit me. I put 2 hands like this up. This is also cut. This is also cut. So now I come with 2 hands. You can't stop bleeding in 2 hands with your 2 hands because you are not Devi. Devis have 4 hands. We have 2 hands. So whichever is bleeding less, do this method, and whichever is bleeding more, you do the pressure method. Or two friends were fighting, both will come to you. Then do this in one person. Okay? If the bleeding doesn't stop, and if it is hands and legs, then you can tie what is called a tourniquet. A tourniquet is tied. Rather than show you slide, I'll just show you. So these are ready-made tourniquets. Correct? This is a ready-made tourniquet, black one. It will look like this. You have to put it across the arm. Then you will see one rod-like thing. That rod-like thing has to be turned. You can see in the orange diagram they have drawn arrows. And then after turning it, take the sticker part, stick Velcro, say you put it back and put it in place. You can always use a tourniquet even in the down. You must have seen when they come to collect blood, they tie something here. That can also be used as a tourniquet. So that is where it is shown in the lower three diagrams. Otherwise, you make a tourniquet. Okay? So I'll need your dupatta, and you come, somebody come again. And one pen, pencil, anything. You give this to me, use it. Pen or pencil, anything. So take a flat cloth, not a string, not a rope. Okay? And she's bleeding from here. So I'm going above. Above means not on the wound, above the wound, not on a joint. So I'm going here, I'm tying this cloth. How much ever tie, this bleeding is not stopping. Second knot will not help. So what I will do, I'll put this. Correct? Just hold the pen. Hold the pen. I'm putting a knot over this. So the pen will remain in place. Leave it. It should remain. Now I'll twist the pen. Okay, if I twist more, she'll get pain. So the person usually will shout, I'm getting pain. Say no problem. Let it pain. Bleeding from here should stop. So till that time, you twist this. Now twist it till that time. If I leave, this will untwist. Huh? So now what I do, I take this end, that end of the pen, and now I tie this. So the pen will also not move. So there will be no bleeding. This in short is called a 2D. And that first thing, just remove and give it some. So in that first slide, this was all ready-made. There was no dupatta, there was no pen, and this is all handmade in the lower diagram. So you can make a tourniquet anyway and stop the bleeding. The belt that we wear, that belt also you can put and pull. Of course, you can't put a hole in the buckle, but you can pull and hold, and that will also act as a tourniquet. Okay, external bleeding you stop anyhow you like. Even if you stop wrongly, it's all right. Internal bleeding you can't stop. If we don't stop bleeding, either external or internal, this person is going to die. Before that, there is something called, medically called the word shock. Why it is called shock, I don't know why they use the word. So don't even break your head that why it is called shock or it's called shock. What happens is when the person loses a lot of blood, or when a person even has a heart attack, or the person has got burns, in many cases we get shock. Means when the blood fluid inside the body becomes less. This shock can be made out by a few things. One is that the color of the palms is always white. And if you have got correct blood, it is pink or red. Whether the person has got black skin here or white skin, it doesn't matter. This is always white. So this has become pale. Pale means fika. Fika means lal has become pink, pink has become white. So if this becomes fika and the person sweats like in a heart attack, even in AC, the clothes are wet. And naturally, the person will feel cold. These are all signs of shock. Okay? In this case, cover the person with a blanket and transport immediately. See, the word immediately is in block capital letter. That means whatever vehicle is available with you, take the person to the hospital. Don't call ambulance. You move the person immediately. Okay? Others they will die. Clear? So when you notice these signs, that is called shock. This person has to be taken to the hospital in any manner, because wherever that bleeding is occurring, that can only be cut open and stopped in the hospital, not by anybody else. Am I clear? Because we want more blood to go to the brain, you can lift their legs and go to cover this person with a blanket. Blanket is not available in the first aid box. The blanket is bigger than the first aid box. Yes or no? No, it is not. It is there in first aid. So when we order food from outside, it comes in an aluminum foil. That is to keep the temperature maintained. Now take a aluminum foil which is as big as a bed sheet, fold it. It will become so much. Put it in the first aid box. Open it and cover the person. Black as a blanket. So if you are having a first aid box, get and keep it. Now, when do you suspect that this person is bleeding inside? That is important, because if it is one of these, then the person is bleeding inside and he's going to go into shock and die. So we have to expect this person is going to go in shock and therefore take the person to the hospital before they develop shock. Any manner you take. Okay, all type of accidents, vehicle accidents, including man and pedestrian and vehicle. Because in हिंदी हम लोग बोलते हैं ना, गाड़ी ने उसको उड़ा दिया, तो ऊपर उड़ जाएगा, उसके पहले हॉस्पिटल. They are bleeding inside. When there are multiple injuries on the body, काफी जगह पे चोट लगा, दूसरे माले से गिरा, इधर भी लगा, इधर भी लगा, उधर भी लगा, या भाई ने 4 आदमी लोग को भेजा, उसने पैसा नहीं दिया, मारना. पर ऐसा मारना क्यों, मरेगा नहीं, मेरे को मुझे पैसा मांगता है. So multiple injuries, so they bleed anywhere. Yeah, of course, gunshot injury you can understand. Bullet has gone in. Similarly, like knife, sword, rod, कुछ भी body में डाला तो. Fall from 15 feet or more. So 3 times a person's height. If they fall from that, they are bleeding inside. After injury, person will cough out blood or vomit blood. That means he's bleeding inside. Okay. All types of contact sports. Don't think of judo, karate. Think of kabaddi in India. एक आदमी गलत जगह पे गया, 6 जन उसके ऊपर गिरेंगे. He'll definitely bleed. Okay. If there is internal bleeding, external bleeding, that eventually leads to shock. So you have to be careful of that. So this bleeding and bleeding was the most important thing. If you want, we'll stop. All right. Yeah, any questions first from those who are sitting at home? If you have not started eating lunch, yes, you have any questions? One second, the first will do. Nothing. Stories are there.
Sir, excellent lecture.
Thank you.
Very enriching.
Yeah, but I want questions. I'm not looking for praises, don't worry.
Sir, which question I asked earlier that you told me it is not related to this question, this lecture, but actually it is happening with my own family. Means my past 3 generations suffer from a heart attack and all.
Will you please go to the question because you're not very clear?
Yeah, sure. If very strong genetic histories, and what will be you suggest to further means prevention of heart attack for new generations, sir?
Nothing.
Any early detection or anything?
Nothing is there in the world which can tell you.
Okay.
They're still trying to come out with certain things, but still nothing is in the pipeline.
Okay, sir. Thank you.
Nobody can tell. Do you think I've got heart attack? Take a guess.
No, I don't think so.
First, I'll give you my age. It is 67. Now you guess.
Not at all sure. Still.
Now I'll tell you something. When I was 28 years old, 28, that is 1985. I can't see you, so I can't guess your age. I don't know whether you were born at that time. In 1985, I had a heart attack. Oh. When I was 28 years old. Because in my family, high blood pressure was there. I was detected as having high blood pressure. I was in the hospital 2 days to find out why I'm having high blood pressure at this age. I came home on the 3rd day and got a heart attack at the age of 28. Okay.
Okay.
Then from after that date till today, I have not got. So these questions are all only theoretical. There is nothing which can tell you don't do or do.
Okay, sir. Thank you.
See,
Sir, can I ask something, please?
one second. You have to take care, that is true. But that taking care is not meaning that you will not get.
Okay, sir.
But not taking care also you can get or you might not get.
You might know.
Okay. Statistics say that people meet with accident, car and vehicle and a pedestrian on the footpath. 80% of the accidents occur on the footpath. Correct?
Yeah.
That doesn't mean you start walking in the middle of the road.
Yes, sir.
Because people are walking on the footpath, 80% of accidents will occur on footpath. So these are all statistics and these are all things. Nothing is there. It is only your pure luck. Anyway, ask the question.
Sir,
Somebody
mine,
else wanted to ask a
yeah,
question.
it's me, sir. It's not a question actually, but I just was curious to know, okay, whatever you shared, stroke and this CPR and all, आपने real life में कब किया है, and can you just share something, which can inspire us?
Yeah. So I've done only once in real life, but then I've taught many places. And if you want next time, if possible, if we know the date much beforehand, here I came to know last week only, and last week I was not well, so we arranged for today. And this whole academic session is ending, so we had to do today. But next time we can plan it. I can get a mannequin and I can do it and show you. Or we can tell all of you to come and see also. And actual AD also.
Okay,
AD also and mannequins also.
Thank you, sir.
We have had this incident in our center, one of the centers, heart attack. Heart attack, अभी वो cardiac arrest का भी heart attack का वो भी पता नहीं है. Now that you have given me that distinction, but this has happened, and it was a sudden collapse, and before that was a lady, before she went into the hospital, she had. अब उस ऐसे समय में वो टीचर को समझ में आके वहीं के वहीं देने के लिए ये अवेयरनेस बहुत जरूरी है. अभी मुझे ये भी नहीं पता कि उसको उतना अपॉर्चुनिटी था कि नहीं था, whether it was there, but if it was there, maybe one life could have been saved. But I don't want to, if that teacher is around, I don't want to create that guilt in her mind, but she did her best. But some knowledge is always required. See, because you are in this kind of a situation, classroom situation, वहाँ पे कुछ भी हो सकता है.
No, more than classroom, people know that you are somehow medically something.
हाँ.
So they'll come running to you and they expect you to give advice. That is also there. In the classroom, it's all right. But at your home,
Yes, people know that you are dealing
something
with the
with
body.
medicine, yeah. Something with medicine, something to do with something. So they'll come. 3 places you will have to encounter this. One is at your work, second is in your own house, and third is on the road. So at your own house, neighbors and all are more important. So she is saying that the same thing happens on the roadside. People usually don't do anything because
they're scared.
They are scared, and there's a word used in Hindi. Police का लफड़ा नहीं बनता. लफड़ा, झमेला नहीं बनता. Okay, because of that, I'm telling you this. What I want to tell you, that there is a law called Good Samaritan law. It is applicable even in India to everybody. Every police station, whoever is the main head inspector, has a copy of this Good Samaritan law, because the government gazette has been sent to that person. If any policeman harasses you, if you do anything and they harass you, go to that police station, tell the senior most inspector, I've done the work to help somebody. This is my home address. This is my office address. If you want to ask anything, send your policeman to my workplace or home place. I'm not going to come to the police station every time, because under Good Samaritan law, I'm not even required to cooperate with you. So like we do this, I'm doing with you all. Like that, we are doing this with Mumbai police also, and we are making them aware because these people come first in contact with road accidents. So we are teaching them CPR. More than teaching them CPR, we are telling them, please don't be harass people who are doing something good. So that is the thing. So don't think police ka problem ke liye you will not do. Do. Even if you call 108, you don't have to give your name. You have to give only the address. You can, if you don't want to do anything, call 108, give the address, put the phone and go away. Nobody can do anything. And 108 has anyway no charges. So they are not going to put the bill to you. Call ambulance if you don't want to do anything.
So my question is whether there is any certification for this, any formal certification?
Yeah, it is there. But
You
you'll
can
have to
share.
pay.
Yeah, of course. Of course.
But not with me.
Whoever agency.
Some
So
institute,
if
yeah.
you have the information, you can share with me.
Definitely.
And if there is a course for that certification,
I'll tell you.
We can do that.
Yes.
Because that gives a proper authenticity. मतलब you do that whatever first aid and CPR. वो मुझे पता है, लेकिन last time वो हमने थोड़ा जल्दी में किया था.
Then we can even, those people can come here to teach. Like for example, I'm a faculty.
We can call. That's how we normally do. Because
okay, any other questions?
सर मुझे एक्सक्यूज मी सर, मुझे स्ट्रोक के बारे में पूछना है कि उसका रीजन क्या है जो स्ट्रोक आता है.
दो रीजन दिया, एक ब्लीडिंग और एक क्लॉट.
नहीं मतलब सिम्टम कुछ पहले कुछ नहीं दिखते हैं उसके, वैसे स्ट्रोक आने वाला है, कुछ सिम्टम्स कुछ.
सिम्टम का मतलब ही कुछ तकलीफ. तो अगर तकलीफ ही नहीं है तो सिम्टम कहाँ से आएगा?
क्योंकि रिसेंटली माई देवर अभी 30 तारीख जो गई है ना, उनको स्ट्रोक हुआ है बेंगलोर में और उनकी आवाज चली गई थी. मतलब थर्ड डे अभी थोड़ा थोड़ा वो बोलते हैं. ऐसे पहले कुछ नहीं हुआ, मतलब उसका कारण क्या है कि ऐसे होता है?
अभी भी पहले कुछ नहीं होता है. अभी कुछ होता तो दुनिया में सबको मालूम रहता है ना. स्ट्रोक होएगा तभी स्ट्रोक होता है. उसको आइडेंटिफाई करके उसका जल्दी इलाज करने का इम्पोर्टेंट है. नहीं करेंगे और इलाज नहीं करेंगे तो फायदा क्या है?
Sometimes you don't understand also. I have lost closest sister cousin. वो मतलब she is running, jogging, registered for a marathon and all, and in the night one stroke gone खत्म.
You are asking ना how to prevent heart attack.
इसको कैसे करेंगे?
So this person is active running marathon, still they got. So there is no rule. No rule.
We don't know also how much time, 5 minutes.
And there are no. देखो सिंपल चीज, चक्कर आने के पहले मालूम पड़ता है क्या 1 मिनट पहले आने? नहीं मालूम पड़ता है ना. वैसे ही स्ट्रोक होने के पहले स्ट्रोक आने वाला है नहीं मालूम पड़ता है. दुनिया में कोई भी चीज नहीं मालूम पड़ता है. कोई भी चीज नहीं मालूम पड़ता है. बुखार आने के पहले थोड़ी मालूम पड़ता है बुखार आने वाला है 2 दिन के बाद या आधा घंटे के बाद. कोई भी चीज नहीं मालूम पड़ता है, इसके लिए उसको सिम्टम बोलते हैं. सिम्टम जब आता है तभी मालूम पड़ेगा.
But when you get this cold and other things, when you are getting symptoms, early symptom को तुमने तभी के तभी अटेंड किया तो.
हाँ, पर कोल्ड भी छींक आने वाली है, नाक बहने वाला है, वो 5 मिनट पहले भी नहीं मालूम पड़ता है ना. जब छींकोगे तभी मालूम पड़ेगा.
आने के बाद में तुम कर सकते.
उसके बाद यू कैन प्रिवेंट निमोनिया. निमोनिया प्रिवेंट कर सकते हो. आपका गला खराब होने का प्रिवेंट कर सकते हो सर्दी को तभी का तभी ठीक करके. बट सर्दी आने वाली है नहीं मालूम पड़ेगा. उसी तरह कोई भी बीमारी नहीं मालूम पड़ती है.
Thank you, sir.
Okay, I think we can end the session. And I'm so glad Dr. Sarosh Engineer has taken this session so interestingly. I'm thoroughly impressed. And I'm looking forward to more association with him to our other sessions, other lectures, especially on our therapy. So some part of the therapy, I'm talking to him. Agar click ho gaya to we will be lucky to have him as a faculty. So we are going to end this session. If you have any other questions, specific question, you can message on the group. Please use the Nai Teachers group properly, positively. If there's anything worth referring to him, I will definitely. Okay.
Or you can always ask him the question. He'll ask me. We can get back to you.
Okay, sir. Thank you very much. चलो एक closing prayer बोलते हैं. ओम असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मा मृतं गमय Om Shanti Shanti Shanti. Thank you very much. I'm closing the session.
Thank you, sir.